You are not going to guess what happened here. This little one here is the sweet soul is Honey.
Hey, Honey. What have you been doing?
Honey's owner saw her with a large object in her mouth.
Ate a spoon.
Ate a spoon.
Not like a metal spoon.
A metal spoon.
Are you sure it's just not gone missing somewhere or?
The owner was getting food ready for the dogs, and then left a bit of food on the spoon, and then next thing you know, bam!
Anxious owner Lyndall is waiting in reception.
I literally dived on top of her to try and pull it out of her mouth, but I watched it go in. It just went in too quickly.
The question now is how to get the spoon out.
The only way to find out is to take an X-ray. If it's a metal spoon, it'll show up on the X-ray.
Okay.
Hey, sweetheart. Yeah, she looks pretty bright. Look at her trotting along. Happy as Larry. What's all the fuss about, hey, Honey?
Can't feel anything in there?
No, she's perfectly fine.
Yeah. Or she'd at least be showing some signs of discomfort. But let's have a look.
We're about to find out.
Ready? Are you ready for X-ray?
Nah, it won't be. Oh my god. Oh my god.
This is the biggest spoon on earth.
Wow, I don't know how we're going to get that out.
It's half the size of her.
Are you okay? Oh.
In Sydney, one of the Shen twins, Audrey, is with Tonkinese cat Misha, who is in a lot of pain with a badly swollen face.
Hi, Priscilla. How are you?
Hey, thanks for getting Misha in the carrier for me.
You're welcome.
Owner Priscilla is hoping Audrey can find out what's wrong with her much-loved 9-year-old.
Her face. Poor thing, I can see it quite swollen there.
Yes. She says yes.
Yeah, she says yes.
Misha's face got really swollen and obviously something was quite wrong and she was not feeling herself. She was like, didn't want to have cuddles and wanted to be left alone. And so we got really worried and we called the vet.
Well, what we'll do is I'll take her into the van, have a good look at her, and then we'll go from there, whether we take her into hospital for more investigation as well.
Okay, sure.
You're worried?
Yeah, I'm sorry.
No, it's okay.
She's my kitty cat,
I know,
special
she's
girl.
your baby girl.
Yeah, I know. Come on, kitty, be okay, right?
Hi, Misha. Let's get inside.
Big step up.
We're hoping to find out what's going on with poor Misha. It breaks my heart to see my cat like this. Yeah.
So it's nice and warm.
Yes.
Here we go.
There you go.
Oh, it looks so swollen. So even just you can see how much swelling there is just underneath the eye, just going to the top jaw. Certainly I'm thinking infection at this stage, and just that pus is accumulating under the cheek there. Her back molar at the top is quite red at the root, and there's a bit of pus dripping out behind the tooth. But once that completely heals, we do need to talk about diet and try to prevent her having any further dental disease in the future. We don't want this happening again.
I am worried. I can see that back tooth is very infected, and what that probably means is her jawbone is also very infected.
So I think with the condition that I'm seeing here, time is of the essence. That abscess is very painful and it's actually getting bigger and bigger. So I think best decision is to take her into hospital today. We'll give her a general anaesthetic, have a really good look in there, and just try and get rid of the problem and the infection.
It's always a bit hard with your fur children. They're like family, so I'll work through it because I know she's in exactly the place where she needs to be to get better.
She's gonna be okay.
Yes, my little kid.
On the Gold Coast, Alex and Gerardo can't believe what they're seeing in Honey's X-ray.
I've never seen anything like that before. Have you?
Never a 23 centimetre spoon.
The large spoon is clearly lodged deep in Honey's stomach.
What are the options?
Okay. To me, the only option is to get an endoscope and get her under anaesthetic and scope it out, unless you think there's another option there.
Well, if we go to surgery, remove the spoon
yep.
from the inside, make an incision in the stomach, but let's try the scope first because if we can get that out without having to go to surgery, that would be ideal.
Yeah. The worry is that getting it out, we could cause more damage, but it's got to come out.
The plan that Alex and I have come up with is we're going to put a camera down there, put a snare around it and slowly pull it out, and hopefully it comes out and doesn't cause any trauma.
All right, sweetheart. It's going to give her pain relief directly via her IV, so gets on board as quickly as possible.
Alex and Gerardo have never attempted to remove an object this size from a dog's stomach.
So I guess we give this a go first, and if it doesn't work...
And then it's to surgery. You ready?
Yeah. Nothing yet. Jeez, I hope it hasn't gone down further.
That's it there. You see?
No, where? Up, there it is.
There. Okay, right there.
Okay.
Okay, you got to keep us in the middle.
Did you want to drive?
If you want me to. I got it.
This is typical. So we can see the very end of the handle of the spoon. What Gerardo's going to do now is try to get a loop of wire around that, and then we're going to try to pull it out. But we've got to remember that the wide part of the spoon is right down in the stomach, and that's the tricky part.
Feeding the loop down now.
I don't know if that loop's going to be big enough.
So we need a new loop because the loop itself is not opening wide enough to go over the spoon handle. So fingers crossed we have one that's big enough.
If this doesn't work, Honey will face surgery.
Oven will inflate with gas.
I knew this was going to be hard, but I think it's going to be harder than we think.
Okay, inflating.
Oh, yeah.
Okay, that's better.
Much better.
Now the trick is...
It's going to be trying to get it over. Oh, yep. Oh, that looks good. Come on.
Try and get that edge.
Come on. Come on, come on. I'm just going to go a little bit further in.
Yes, please.
Yep.
Okay, tighten down, Amelia. You tighten down? Okay.
I tighten down.
Whoa.
We've got Misha.
Come on in. Hi, Misha.
In Sydney, Audrey's about to start Misha's dental surgery with vet nurse Iona assisting.
Right, so we're going to take some bloods and pop her onto fluids, and then after that we'll get her ready for her dental procedure.
Sounds good.
I want to check her kidney function, liver function, make sure that that's all good to take the anaesthetic today. She's an older girl, so we need to watch out for those things. All right, the bloods are
the bloods are up.
Great. Okay. Well, it's not unexpected. So these 3 kidney enzymes are all elevated above normal, and not surprising that the globulins are also high because she's got a nasty infection in her mouth.
Yeah.
There's obviously an urgency to get this procedure done. She can't stay there with an infection growing in her jaw and in her cheek. It's actually burst. You can see some pus coming out from the inside of her mouth, just dribbling down her lip there. But I am a little bit worried. She has got a pre-existing kidney issue, which isn't uncommon in an older cat. So we do need to be careful with the general anaesthetic.
Hello?
Hi Priscilla, it's Audrey from Aussie Mobile Vet. It's all good. She's having a little bit of a cuddle with me and Iona at the moment. The reason why I'm calling is that we've run the bloods and it's not unexpected. 3 of her kidney enzymes are elevated.
Yes.
So moving forward, we still need to go ahead with the procedure, but we'll do everything we can to make sure that her kidneys function well during the anaesthetic.
Thank you so much.
Okay, talk to you
Thank
soon.
you.
All right, bye.
All right, bye.
So now I've got the cannula in, I'm gonna pop her onto the fluids, and that will just keep her well hydrated before we start any of her general anaesthetic. So Misha's a bit of a tricky case because obviously being an older cat and having kidney issues, you're not keen to put her on the anaesthetic and put her through that. But unfortunately, she's got a condition that's life-threatening. If we leave it, we've really got to go in and get that infection out. Otherwise, she could die from that. Right, so we're gonna go really slowly with her anaesthetic. I only want to give her enough so that she just goes to sleep. We've just got to be careful with those kidneys.
All right.
No, we found the vein, so I've just given it through the needle. What we're finding is the veins collapse with the catheter, so I'm just going to give her some time to go to sleep. So what I'm doing there now is just giving her some gas. Like that is... Oh gosh, the abscess has just burst with that pressure.
Good morning, boys. Big day. You all know what you got to do?
At the Australian Reptile Park, Tim and his team are doing some renovating.
Let's get into it.
But it's inside the enclosure of one of the park's deadliest and crankiest residents.
Elvis is the reptile park's 5-metre saltwater crocodile. Crocs are these big monsters, but they're very sensitive. We have carpet on the edges where he comes out. That carpet is deteriorated. When he walks on it now, bringing 500 to 600 kilos out of the water, it creates a little bumblefoot, which can lead to a serious infection. So our mission's pretty simple. We've got a mat that's torn, that's going to hurt his feet, and we've got to replace it as quick as we can. No back to the crocodile. Okay, that's the golden rule. Let's get a bit of food in his belly, and then let's get set up.
The team will be working just metres from the massive Croc.
Elvis is hands down one of the park's most iconic animals. About 25 years ago, he was caught from Darwin Harbour for attacking fishing boats, trying to rip their motors off. Fortunately, his life was spared, and he now resides at the reptile park in a territory of his own where there are no fishing boats and no people to hurt him. Dano, just give him a bit of food, mate, to fill that belly up before we start. Might take that interest away from us. Where's he going? Come on.
The water level in the pool will have to be lowered so the team can safely get across to the ripped matting. Elvis is now wary of all the new activity.
Elvis is hands down our most dangerous animal. If Elvis grabs you, that is instantaneous death. He literally has one of the strongest jaw pressures on Earth. It would crush and pop your skull like a watermelon. Oh. Let him have it. Oh. Back up, boys. The feed went well.
Yeah, heart rate went up a little bit.
So now it's our job to get in and get this carpet done. Danny, you stay on Croc.
Easy.
We've got to get the pump in, drop the water level. Let's make sure we've got our sticks, and the three of us switch right on, and you're on that Croc, mate.
Yeah, I'll call out if he moves.
Let's get it done. There's a great level of trust. Dan looks after the Croc, we look after the job. The risks are that if you get bitten by this crocodile, if you don't die, you're going to lose a limb. It's a really bad outcome. That's why you've got to have a spotter. That's Dan's job. Watch Elvis.
Tim, he's just at this other bend.
Try and hold him, mate.
Yeah, I'll bring him back. Come on, Elf. Starting to come around again, Zach.
He's on the move.
Yeah, he will move back quick too, so you be ready to go. Come on, come on. Yeah, you're right. He's back on me.
You sure?
Yeah, we're good. You're good, you're good.
Right, let's get to work, boys.
He's starting to move, boys. Out, out, out. Boys, he's starting to go. Go, 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 go.
On the Gold Coast, Alex and Gerardo are working on greedy Bulldog Honey, trying to remove a metal spoon from her stomach.
I knew this was going to be hard, but I think it's going to be harder than we think.
They're hoping they'll be able to grab it using a specialised lasso. If this doesn't work, surgery will be the only option.
Try and get that edge. Whoa. Okay.
All right, this is just the first step though, remember. That is a metal on metal and it could easily slip.
Okay.
So we're just gonna have to go really slowly. Yes,
Let's see if we can pull it and
just
Alex.
Go slowly. I'm pulling back and it's not wanting to come. So the problem is that we're getting the wide part of the spoon up to the esophageal sphincter and it won't come through.
So the plan is that we're going to put this down there and we're going to open up, and hopefully that opens up the sphincter so the spoon comes out with it.
The procedure is becoming more complicated than they hoped.
I'm stressed as hell. Forward, Alex, please. They just do not want to go.
Oh, wants to dig a big hole in that esophagus.
So now we're pulling the claw out with the jaws open. We're pulling.
Something's coming.
Pull.
Yeah, she's coming. Oh my God.
Okay.
So it's out of the stomach, which is the first step. Now we've got to get it up the esophagus without doing more damage. Ready?
Let's go, guys.
Okay.
Let's go, team. Go. Oh.
Oh gosh. Oh, the abscess has just burst with that pressure. You might need a bigger bag as well later.
In Sydney, Misha's much-needed dental surgery can now get underway, with Audrey keen to keep the 9-year-old cat under anaesthetic for as short a time as possible.
So she's nice and anaesthetised now. She has the anaesthetic gas going through. So what I'm going to do is change this mask into a tube. Okay. And that will just deliver the gas straight to her lungs. All right. It's a bit hard to manoeuvre with a swollen cheek and a swollen mouth and a burst abscess in the mix, but so far so good. We're just connecting her up to the monitor now. That's going to let us know what her vitals are throughout the procedure. Close. 1, 2.
But suddenly,
Again.
there's a problem.
So we've got Misha anaesthetised, then she stops breathing. She's actually not taking any breaths on her own, which can sometimes happen, so I'm just breathing for her. No. Okay. She's getting light. Come on, baby girl. Let's breathe on our own. Lucky for us, her heart is stable. We've just got to breathe for her. So Iona's there on the bag breathing for her while I just get on and do what I have to do. So here's the bad tooth. You can see the roots all infected. There's pus coming out the back of it as well. So we're going to have to take that tooth out. I think the reason why this abscess in the cheek is formed is because the root of that tooth has become infected, and that's because she's got bad teeth. So with dental disease, when the plaque builds up and the calculus builds up, it traps bacteria, and that feeds into the root of the tooth and the gum. So what I'm doing is slowly pulling the gum off the roots, very, very gently. And I'm loosening the tooth from its attachments to the jawbone. I can see that some of those roots have dissolved away, probably because the infection is so bad. Okay, but it doesn't look like a normal tooth because all its roots have like rounded off. So these roots should be much longer than they are. So it's gonna be important moving forward from now, how we keep these teeth as clean as we can. All right, we're gonna suture up this big hole where I took the tooth out of. We've given it a really good flush with saline to get all that pus and infection out. Once we've done this, we're going to clean up all the rest of her teeth and wake her up and send her home. I'm really looking forward to taking Misha home to Priscilla. I know that she's waiting anxiously for her. I'm also really excited to tell her that we managed to get rid of the problem and how we're going to move forward to make sure that this doesn't happen again. Now, are we breathing on our own? Let's have a look. She's breathing now. We're all good.
He's starting to move, boys. Out, out, out. Boys, he's starting to go. Go, 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 go. He's not stopping.
At the Australian Reptile Park, Elvis the crocodile has made a desperate lunge at Tim and his team. They're inside the massive Croc's enclosure, trying to repair damaged matting at the edge of his pool.
We're good, he's on me.
Happy days?
Yeah, jump back in, jump back in.
Okay, back in, boys.
Yeah, you're good, boys. Back in. He's back on me.
Right, let's rip this last bit up.
He's starting to come around though, boys. 40 seconds maybe.
Can you stop him?
Maybe.
Try and hold him, mate.
Yeah.
Righto, boys, we've got to move fast because he's coming.
The waterlogged carpet is heavy and cumbersome, making the job difficult. Elvis senses intruders in his pool.
What are we stuck on?
You've probably got 30 seconds over there, guys.
30 seconds, boys.
Yeah, get him. You have to move, boys.
Just tear it if you have to, fellas.
Boys, he's starting to go. Jump out. Jump out.
Righto, Dan, we're out.
All right.
We've got the heart going. It's easy to look at Elvis and think, oh, he's calm, he must be trained. He's not. You think about a wild crocodile. Animals don't see them before they attack. They're calm. They creep up. Whack! That's how it happens. And that's what Elvis would do.
With Elvis now on high alert, it's going to be even more dangerous for Tim's team to go back in and try and glue down the carpet.
Everybody's spreading the glue out, there's toes and feet in it and it's going everywhere. But it's nice when you've got a team all working for a common goal. Righto, Dan, we're coming back in.
Yep, gotcha, he's on me.
I'll just get the corner so you can go down. It's all hands on deck at this stage. The glue's down, you want the carpet on, no air bubbles. More bodies make light work.
Just push it all down. How's it looking, boys?
Good.
Boys, he's starting to go.
Elvis is curious about the team's handiwork.
Look at that. He's coming to have a look at it.
Yeah, all that hard work. What do you think, big boy? Looks like he's smiling.
He's smiling. That's a good job for us anyway, boys. Let's hit the hoses.
Yeah, all right, sounds good.
See what Elle thinks. The pool will take overnight to fill, but as soon as we can get that level up a bit, we can get the heaters on, get his water warm, job done. Well, he's had a look. He's back in the deep spot. The hoses are on. We're all safe. We've got one happy Croc. Let's get out of here.
Let's get out of here.
In Melbourne, new mum Danny is saying goodbye to her family before she heads to work at a busy vet clinic. Her first patient is a 12-year-old beagalier called Buddy.
Hello guys, how you going, Deborah and Erin? You well?
Good, thank you.
It's good. What brings Buddy in today?
A couple of days ago I was patching him and I found a lump.
Oh, okay.
Danny examines the right shoulder of the much-loved family pet.
Okay, I can feel that there. So do you think this came up quite suddenly?
Yes, it did.
Okay. Has it changed much since you've noticed it?
No.
Like it's gotten any bigger at the moment? No? Okay.
Stayed the same.
Alrighty. Well, what we might do, I'll bring Buddy into the clinic, we'll have a look at that lump, get a sample, and I'll give you a call and we'll make a plan from there. How does that sound?
Good, thank you.
Sound good?
Yeah.
Okay, Buddy boy, you want to come with me, mate? You good boy? You sweetie pie. All right, you say goodbye to Mum. Come on, mate. Buddy, come on, Papa. Hey. Oh, thank you. Good on you, mate. Yeah.
He's an unusual looking cavalier, isn't he?
Yes, he's actually got beagle in him. So he's Cavalier cross beagle. Hey? So he's quite a cute little mate, aren't you? Hey?
Beautiful little breed.
All right, do you want to have a little listen to your heart? So we have got Cavalier in there. Yeah, make sure we haven't got any murmur. Good boy. All right, mate. So just for this lump. So there's the lump there.
Okay.
Yeah, so the lump is feeling quite firm there. It's in that subcutaneous tissue. So we'll have to get a little sample to see what it could be.
Yeah, definitely. Make sure it's nothing nasty.
Oh, we're
Ready?
brave, so all right. Just grab that little lump there.
Good boy. Very brave.
Good
honey.
mate.
Well done. Good boy.
I'm just taking a needle sample from this lump on Buddy's shoulder. I'm going to have a look under the microscope because that will give me the best indication of what this lump is. And unfortunately, I am seeing some cells there that I really don't want to see. So I'm concerned that this could be quite a nasty tumour. So I do think we really need to get onto this quickly. I want to get some chest x-rays to make sure this hasn't spread. And then if we're all clear on that front, I want to head straight to surgery for Buddy today. You're very brave.
Good boy.
On the Gold Coast, Alex and Gerardo are almost an hour into the delicate procedure to remove a 23-centimetre spoon from Bulldog Honey's stomach.
Oh,
it's coming out.
Yeah.
my
That's pharynx.
They've been extremely careful not to cause any internal damage to the young patient.
Here we go. Oh my. Wow. Oh my goodness. It's a spoon.
That was.
Cannot believe it. Good job, guys.
Look at that. That's how big that spoon was.
She's going to be so sore tomorrow. I cannot even imagine. I think probably rest in hospital tonight and then get you home in the morning.
The big test now is to see if Honey's appetite has been affected.
All right, I've got some chicken here for her. It's a really good sign if she eats a bit of this. Ready? I want to see how you can swallow, because I would say, if I was you, I would have a very sore throat. All right, let's just start with a little bit. Oh, thank you. Oh, no problems there at all. You are one lucky dog. Good girl. So we're going to send her home on some medication, just because she's got some ulceration from the trauma from the spoon, and we want to make sure that that all heals up. She's off. In here, in here. This way. Who's in there? Who's in there? Oh. She just ate a little bit of chicken for me then, so just want to make sure she was all good with that. And I also thought I'd better give you the spoon. I don't know if you still wanted it, but I thought you should really hold on to that, so, okay. Good girl, hey? You've got to stay out of trouble.
Thank you.
See you guys. I think she's gonna be one very lucky dog.
Oh, she's a lovely owner. She absolutely loves the cat.
In Brisbane, the other Shen twin sister Alison has had an SOS from a family with a very pampered cat.
How are you? Good.
Mum Lawton says Ryder is the boss of the household.
Ryder is about 7 years old. The boys absolutely adore him. He sleeps in our beds. He follows us around like a dog. He's just gorgeous.
All right, shall we pop you to the van and have a look at this wound?
The family wants Alison to check out a nasty wound on Ryder's leg.
Come on, Ryder. Hey, get you in. All right, let's get you out.
So we get Ryder in the van and we take him out of the carrier. And at first impression, he looks pretty good. I mean, his coat looks really good from the outside, but he's a little bit nervous at this point because he's not used to strangers.
Oh, your heart's going really fast there. You are scared.
We took him from RSPCA as a rescue cat. So as soon as someone else is around, he gets very uncomfortable and very scared.
We'll try and make this quick and painless, I promise.
It's like he's got trust issues.
Hey, baby. Okay, so where is this lesion?
He's on the inside of his back leg.
Okay, I'll get you to show me. Come on, come on.
Oh boy, well, there you go. You're being really good. Oh, Ryder, ouch! That looks really nasty.
Poor thing.
In Melbourne,
Hello, Deborah.
Danny is getting the owners okay for surgery on Buddy the beagle ear.
There are some lumps that are looking quite suspicious to me that could be some nasty tumour cells, so I think it'd be really important that we get this lump off Buddy as soon as we can.
Okay.
It's really important to get a chest x-ray just to make sure that whatever is happening there hasn't spread to the lungs. Okay, we'll just get your fluids connected.
Danny is concerned about Buddy's size.
With any anaesthetic, there's always a risk, but when we are particularly overweight, like Buddy here, there is an increased risk of anaesthetic, so we just have to be really careful about our monitoring, making sure he's breathing well and that he's coping with the anaesthetic today.
X-ray.
All right, let's see what these x-rays look like. Okay, there's no evidence of any spread of this tumour to the lungs, but we aren't out of the woods yet. Until I get a biopsy of this lump, I'm not going to know how serious this is. So for Buddy, it means we've got to get to surgery ASAP. He's a good boy.
All right, chickadee, you're on the way home. Mommy's gonna be very happy to see you.
In Sydney, Tonkinese cat Misha has recovered from her dental surgery, and Audrey is returning her to owner Priscilla.
There's Mummy. Hi, Mama, we're home.
Hi, Misha.
She's been such a good girl for us.
Hey, baby girl.
She looks so good, much better.
Yeah, I'm gonna take her out so we can have a closer look.
Awesome.
Welcome home, Misha.
Wanna come out to Mama?
Come here.
I'm feeling so relieved right now that my Misha is home. Thankfully, she's so much better now, and I think within a few days she'll be back to her own little sweet self.
So everything went really well in hospital today. I'm really happy that we took that tooth out because there was so much pus and infection behind it, and that's why you had that bubble on the cheek bursting through. Also on the other side, I think that was also about to happen because there was quite a lot of pus in there as well. So we've given it a really good clean, a really good polish, and moving forward, I think the key is going to be keeping her teeth clean so she never gets another abscess again. Such a good girl for us in hospital today, weren't you, chicken?
She looks so much better.
Yeah, her face has gone back to normal, hasn't it?
Yes, she's got cheekbones back now.
You got your cheekbones back.
Yay.
All right, Chicky. I'll see you in a couple of days. All right, bye, Priscilla.
Bye.
Good girl.
Hi, Kate, how you doing?
Hey, Margaret, how are you?
Hi, sweetie. How you been?
Yeah, good. Are you coming to visit? You've always got something exciting.
Yes. Have a look today.
I've been able to get a little sneak peek at reception. I can see a little bit of fur. I'm just hoping that there's not too many sharp claws and there's a whole lot of cute and cuddly.
Very sweet little fellow.
Come on in.
At Kate's Bondi Vet Hospital, carer Margaret has arrived with a mystery visitor.
Look what is in this bag. Hello there.
This is Wilbur, Kate.
Hi, Wilbur.
Say hi to Kate. So Wilbur's a 10-month-old baby wombat. The mother was a roadkill, unfortunately.
Oh, did your mum get hit by a car on the road?
Yes.
So this is his 4 kilo check?
Yes, please, yes. I just wanted to make sure a few things were right with him.
The little orphan is being hand-raised, but hopefully one day can be returned to the wild.
Are you a bit nervous about coming to the vets?
Wilbur is quite a strong-willed little animal.
Goes out, I know Wilbur. I know. He's like, I don't know about the vets. I don't know about the vets. I can hear your tummy grumbling. So what we might do, Margaret, is I'm going to get you to hang on to him.
Hold his teeth.
I know, sweetheart.
Shh. Otherwise I won't get him.
Hey, Wilbs, can we just have a look at your little choppers?
Good boy,
They're
Wilbur.
beautiful. These are looking really good. You've obviously been giving him quite a lot of hard things to chew on.
Good.
Can I just have a look at these back feet?
Sure can.
Mm-hmm.
You're doing so well.
Yeah, have a little listen.
I hope he's going to let you.
He's a little wrigglewort, isn't he?
He's a wrigglewort.
You're a little wrigglewort. No murmur. Heart rate's good.
He has been a little bit itchy, and I wasn't sure whether it was due to the digging or the fact that he's only young and his fur's just coming in.
Yep.
But I would like to just have a look to see there's no mange issues.
You know, his fur is a lot shorter around this back end than up around here, so you can just feel how it's quite lush around up here, and it looks like he actually does do a little bit of rubbing down this back end. These guys do get sarcoptic mange.
They do, yep.
Australian wombats are really prone to getting what they call sarcoptic mange. It's a little microscopic parasite that burrow into the skin and make them really itchy.
I know.
So Margaret, I am going to actually give you some things to treat sarcoptes.
Okay, great.
Okay,
Thank
so
you.
it is a really common problem in the wild, and you know that even sometimes when we treat it, it can come back at a later stage anyway.
Yeah, it's just good at having that reassurance. Really appreciate it.
See you, Wilbur. You're okay, little mate.
In Melbourne, big-eared Buddy is being prepared for surgery after Danny discovered cancerous cells in a lump on his shoulder.
Whenever we take out a lump, we do need to make sure that we're getting enough of a distance from the lump that we gather all the cells that are involved in it. If we do leave any cell behind, then potentially that same mass can regrow. So that's why we're getting a nice big margin when it does look like it could be quite aggressive. Don't want to take any chances. All right. I'm really happy with how surgery's gone. We've managed to get the entire lump out. Now we just have to send that off to the pathologists to get a biopsy done, and fingers crossed it's a good result for Buddy.
All right, you just rest up now, mate. Okay? You rest up, sweetie pie.
So where is this lesion?
It's on the inside of his back leg.
Oh yes, there it is.
In Brisbane, Alison is checking out a nasty wound on rescue cat Ryder's back leg.
Oh, you can definitely see he's been licking. Yeah, so what he's actually done, I'm presuming because you've seen him lick, he's actually sort of torn the skin apart there. And because in his mouth there's a lot of bacteria naturally, he's probably given himself an infection. So open wounds and open lesions like that we do worry about a bit more. It's really done some damage to this side of the leg.
It's really nasty. There's been a lot of licking, there's definitely been a lot of chewing, and he's actually bitten through his skin, so there's actually open wounds there. And that's a problem because it can get quite infected, and that infection can spread.
Alison is starting to suspect the reason why Ryder has been licking and chewing his leg.
So I know that you have seen a couple of fleas on him in the last couple of days. So that definitely sounds alarm bells to me because he could actually be quite sensitive to the fleas and that's what's triggered off the licking. I mean, at this time of year, we certainly do have a lot more fleas around as well as probably in his environment.
So I'm going to give Ryder a good check over. I'm going to use my little flea comb and just see if I can see any live fleas or flea dirt, which is actually flea poo, just to give us an indication if that's what we're dealing with today.
Yeah, there could be some just up here, you see that skull?
We can definitely see evidence that there has been fleas. So it's actually dried blood because after the flea bites Ryder and it defecates, it actually has the blood that comes out the other end, and that's what we see there.
That's not good for your mum and dad?
I'm really concerned because Ryder does sleep with you guys in bed, and with all those flea dirt and flea eggs around, I'm really worried that they might be hatching and then causing you some issues if the flea does bite you at night. So we definitely need to make sure we're cleaning the environment. So washing the sheets in just some very hot water to make sure that we kill all the fleas, the flea eggs and the flea larvae, just so it doesn't pose any health risk to you and your family. So at this point, it's looking more and more like this is actually a flea allergy dermatitis, so an actual skin infection due to the fact that he's been quite allergic to the flea saliva. If Ryder actually ingests those fleas from all that licking and chewing, he may actually get a secondary infection with tapeworm, which is an intestinal worm which can cause a lot of problems. All right, so we're going to treat the infection first because I think that's his main cause of discomfort, all that infection. Hey, buddy. So I'm going to give him some oral antibiotics, so it does mean some tablets. And the other thing I'm giving you today is just a topical cream. It's got a bit of antibiotic, but also something in there to stop that itching. So it's just a little vial of liquid that you pop at the back of the neck every single month. And it's really good because the fleas don't actually have to bite to get the product. So that means he won't have any flea saliva injected into him, which we know he's very allergic to.
Boy.
Shy Ryder is being very patient as he gets his first dose of flea treatment.
No more fleas.
It needs to be applied every month. It's a quick, simple, easy way of preventing against fleas, and the difference it will make to Ryder is immense. So we do need to address one other area, which is the environment. So wherever Ryder's been sleeping or spending most of his time, there's quite likely to be a burden of flea eggs or flea larvae. So a good idea will be just to clean the bedding wherever he sleeps and just give that area a very good vacuum so we've got the environment under control.
I'm really happy that Ryder can go back to being his happy, comfortable self again, and hopefully it does the trick.
In Melbourne,
Want some food, buddy?
Danny's patient Buddy is recovering from lump removal surgery, and he seems to have worked up quite an appetite.
Yum, yum. Yes.
I think Buddy's a little bit excited to get some food and he's recovered really well, so it's time for Buddy to go home.
Hello! Here he is.
Owner Deborah and her daughter are excited to see their special boy.
I'm really happy with how everything went today. We've sent that lump off to the lab, so we'll give you a call once the results come through, but fingers crossed everything's going to be okay. Here's some pain relief in this folder for you to get started, all right? And we'll speak to you soon. All right, you take it easy, little buddy boy. You just rest up, mate. Hey? Oh, do you want me to help you with him? Oh, dear. Oh, mate. Oh, you tubby boy. All right, you okay there? We'll speak to you soon, okay? I'll get that for you. See you later.
2 weeks later, 12-year-old beagle-eared Buddy has recovered well from his lump removal. And great news for his owners, his biopsy results have come back all clear. Greedy Honey is also feeling a lot better after having that large spoon removed from her stomach.
Spoons are definitely off the menu for Honey. Good girl, yeah.
Cheeky Wilbur has no more skin issues and is continuing to thrive. And 9-year-old Tonkinese Misha is now eating and enjoying life pain-free.
Dan to Tim, mate, we're out the front.
At the Australian Reptile Park north of Sydney, conservationist Tim and his team are trying to play Cupid.
Big day for Daenerys?
Yeah, mate, yeah, we'll head down, pick her up, but she's been all right. She's been behaving. Her mood's been pretty good.
And has she eaten?
Yeah, a bit over a week ago.
Good, so she's clean.
She's clean, yeah.
Perfect.
We should be right.
Let's go and get her.
Jump in.
Today is a big day for Daenerys, our female Komodo dragon. She should be cycling. She should be ready to breed, but we need to make sure whether she has eggs developing or not before we introduce a male. Hold on, boys, I'm just going to sort this out. We pull up, and before we've even left the van, I spot 2 of our teenagers having a Barney. They're up, and they're boxing. It's that time of year. These 2 roos are best mates, normally. I just keep an eye on it. The grunting's getting louder, then there's a big right hook. If I see some fur start to fly, or it seems to get out of control, I've got to stop them. Hey, boys. Hey. Leave him alone. Leave him alone. Sit down. Sit down. There you go. There you go. Good boy. Is it dangerous? A little bit. But the reality is they don't associate me with something they want to fight. So if I just walk in slowly and make my presence felt, they should stop. Leave him alone. Go on. That's a boy, yeah, you won. Off you go, mate. See ya. Right-o, let's go.
Trouble averted. Now Tim can turn his attention back to Daenerys.
Probably the best thing to do would just be let her walk straight out.
She'll come straight away?
She'll come out. And if we need to, I'll pick her up.
We have a plan. Daenerys goes for a walk every day, and her main relationship is with Dan. He's known her since she was very small. Dan opens the door. Hello. Daenerys comes strolling out and she goes for a walk through the park. We're going to do most of that, but we're going to turn right and jump in a van. Look at that. What a lizard. As friendly and accustomed to this as Daenerys is, she's still a Komodo dragon. Inside that mouth are razor-sharp teeth, and they're venomous. So they bite a water buffalo on the leg. The venom goes in, the bacteria causes an infection. That's how the prey dies. It's no different if they bite us. If Daenerys grabs on, and she means it, she won't let go.
In Bondi, Kate is making a very special house call for a patient in desperate need of some extra TLC.
Brucey, come on. Come on, in you come. Hey, how you going?
Bruce is a 3-year-old rescue dog, and his worried owners, Martin and Anna, have called Kate because they're extremely worried about their special new boy.
So Brucey's been struggling a little bit with some anxiety.
Yeah, what we really notice it is that, like obviously right now, but when we're leaving the house,
yes,
putting your shoes on, put a hat on or something like that to go
yes,
for a run, you can see his mood changes.
Yes.
So he really starts to get anxious. You can see it build. And then once the door's closed, there's just this noise that just comes out of it. We love him dearly.
Yeah, he's like our little baby.
Yeah.
Bruce's anxiety probably comes from a few places. You know, it wasn't till 6 months till these guys adopted him from the shelter. We don't know what kind of a background that Bruce had. When I first saw him, he was really thin. He was really neglected. And I think that that has a large part in this particular case, in that he would be so worried about these guys leaving him.
We were struggling and getting anxious ourselves to leave the house, so we had to tippy-toe around. It got to a point where, you know, it was really challenging for the both of us.
And Marty, you said that I could probably hear this from the vet clinic.
Yeah.
So it's got to be pretty loud.
Yeah, I've gone for runs and I will run about 1 kilometre away and I can still hear that noise going on.
Wow, 1 kilometre.
Yeah.
It's really painful.
So-
As soon as we leave the house, your heart just breaks hearing him. And
So you guys are basically trapped in your house.
It feels a little bit like that at the moment, yeah.
He would be walking around all the time thinking, oh my gosh, I'm going to get left. That constant worry and that constant anxiety, he can't live like that. So what I'm going to do is put cameras inside and out near the gate, and then we're going to exit and we're going to see what happens when we go, okay?
Yeah.
So let's put some cameras up.
Sounds good. Let's go.
Hey, we got here?
Simba's swallowed some Tiffany jewellery, so Mummy's not happy with him.
That isn't very good at all for anybody.
On the Gold Coast, Alex is dealing with an unusual cat burglar who seems to have developed a taste for his owner's jewellery.
So when you say Tiffany jewellery, what sort of jewellery?
So she's saying a heart-shaped or a pendant about that big, so maybe about 10-cent coin, something like that.
Okay.
So.
And how sure is she that he ate it?
Pretty sure.
Simba's owner, Amina, immediately became alarmed when she noticed her expensive Tiffany locket was missing.
I didn't see him swallow it. He was biting me on my wrist, and then I took off the bracelet. I looked around my bed, looked on the floor, looked everywhere, and I was like, did you swallow it? And he looked like he was like ashamed or angry or something. He just ran off, and I'm like, oh my God.
Looking a little bit sheepish.
Expensive taste.
Okay. Can you stay with me, Simba? I've got to check you out and find out if you've had a bit of a taste for expensive jewellery. Hey? Cats are generally pretty smart with what they put in their mouths, so if Simba has eaten it, this is a pretty unusual situation. His heart rate's okay. I just want to feel of his tummy.
Amina acted quickly, but Alex is concerned the missing locket could already be deep in Simba's gut.
Cats and metal don't go well together. If Simba has swallowed a locket, it could poison him through metal toxicity. So if it's in his stomach, then we've got a chance of getting it out. But if it's gone through further, that'll be surgery. The question is, has Simba swallowed the pendant or not? And the quickest way for us to find that out is to take an X-ray.
Come on, big boy.
A lot of the time we take an X-ray and there's actually nothing in there and it's good news and they can go home. So fingers crossed that's what's going to happen with Simba.
Good boy, darling. Hang on.
Hey, it's a bit worried, aren't you? Good boy. Oh wow, there it is. It's big. That is not going to be easy to get out.
It's really big for a small cat.
Yeah, that's not good.
No,
it's not good for you, Simba.
Simba's been nabbed, and suddenly his pricey snack has landed him in a whole lot of trouble.
Oh, Simba, what have you done?
That's huge. Gosh, how did he swallow that?
On the Central Coast north of Sydney,
You think she's going to head all the way to the van?
Australian Reptile Park boss Tim is preparing to take Daenerys on a road trip to find out if she's fertile.
Some days she goes left, other days she goes right.
Just taking the lizard for a walk.
But the huge Komodo dragon has other ideas.
That's sun pose. The lady needs a bit of sun. We've got an appointment at the vet's, a set time. So it's a short sunbake today, and off to the vet's we go.
Brendo, you got that backpack? Yeah, good stuff, mate.
Inside the bag are tools and equipment to get a Komodo dragon off your arm or leg if they latch on.
I'll grab her from the front.
Yeah, let's do it.
You grab it?
Yeah. Got her? Every time when Dan's holding Daenerys and that head goes up near his face, we're always cautious. Her teeth are long enough and sharp enough, she'd go straight through the arteries. Really bad.
Okay, ready?
Good.
There we go. In you go.
She's a little agitated, but she's in the back of the van and it's a quick trip to the vets.
How's she going?
She's about 40 centimetres from your head.
No throat puffing or anything like that?
No, perfect, mate. She's still tongue flicking.
When you're working with a lizard like Daenerys and you're looking for a few different signs, potentially if she's going to come towards you, maybe to try and bite. One of those signs might be bending the tail. They've got a really strong muscular tail that they might try and whip you with. But also too, they'll start to puff out their throat. They'll start to grunt. They almost become very, very vocal.
The team must get Daenerys inside before she gets too distressed.
Here she is.
There's our pretty girl. Open the door so you can go on in.
There's something about holding a Komodo dragon out in front. She lets me do that. If she didn't want me to, she would let me know.
What we're looking for is eggs. They'll still be attached to the ovaries. They're not fertilised, of course, she hasn't mated. And those eggs will be just above the pelvis, so in the lower belly. If we put Kraken in with Daenerys, when she's not ready or not receptive, they'll fight. Now, when Komodo dragons fight, it ends very badly. So we're talking real serious lacerations, lots of blood, and something we need to avoid.
In Melbourne, one of Danny's regular patients is arriving, 12-year-old Labrador Buddy with owner Hayley.
He loves his walks, he's very energetic, he's a very bouncy dog, and the last few months he hasn't been himself, that's for sure.
Buddy's been struggling to walk properly, and the family is becoming increasingly concerned about their elderly boy.
My girls are very upset about it, and they don't want to see him in pain and like this, so yeah, it has been hard, it has.
Hi, Hayley and Ava, how are you?
Good, how are you?
Good. Hey, buddy boy. Give me a say hi.
Oh, hello, hello.
How's he been?
A lot better since he's been on his medication, definitely.
Wonderful.
Yes.
Wonderful. So Buddy's come in today because we saw him a week ago and he was quite lame and sore in that right hind limb. I have a feeling we've got some cruciate disease going on, but considering his breed, his age, and the fact there is some quite significant swelling and thickening around the knee, I am concerned there could be a tumour there. Oh, I'm glad he's feeling a bit more comfortable.
He is, for sure.
He's still looking a little bit tentative on that leg, a little bit sore still.
Definitely.
Yeah? Yes. Okay. We'll get some x-rays today under sedation and just see what's going on there, and hopefully we can get some answers and make a plan from there. All right?
Great. I'm very excited to find out, and we'll do what we need to do to get it fixed.
Okay, buddy boy. And your mate. You want to come with me? You say bye to Mum. Bye, Mum. Bye, Ava. Oh, big cuddle. Oh, you're gorgeous. Okay. See you later. Bye-bye. Oh, you're going to take me for a walk. Okay. You want to come this way? You good boy. See you later, guys. All right, mate, let's have a listen to your heart. Hey, have a listen to that ticker. Good boy. All right. So having a feel along this leg, I'm just feeling for areas that are painful, any thickenings. I have a feeling there's probably some cruciate disease going on, but I am concerned it could be cancer. There's definitely something going on there. There could be multiple things going on.
So let's put some cameras up.
Sounds good. Let's go.
In Bondi, Kate is using modern technology to try to work out what's making rescue dog Bruce so agitated.
Okay, we've got our last little camera, you guys.
Yep.
We're going to get Bruce outside.
Sounds good.
Come on,
buddy.
Brucey.
Let's go. Good boy.
We're going to put this camera down and then we're going to exit. Okay, let's just put this little one down here. You can already see Bruce is very anxious. Not happy about us going.
Yeah, it's fun.
Oh my goodness. This is worse than I expected.
Yeah, it's pretty painful. It's hard to hear as an owner.
Oh, it's bad.
So we have to organise, Anna, it's your turn to go, or my turn to go, or whatever it might be, you know.
Or one of us can't leave, we have to wait for the other one to come back, so then we can take shifts to go out.
I actually think at this point the whole of Bondi can hear him.
Yeah.
Definitely.
The other neighbours are yelling at him, so it's become a neighbourhood issue, not just the house now.
I'm honestly surprised that he hasn't hurt himself.
Yeah, well, yeah, exactly. We're waiting for that.
And if he hasn't hurt himself by now, he's going to.
Yeah, what's the matter?
It's only a matter of time.
Yeah.
North of Sydney, the ultrasound on feisty Komodo dragon Daenerys is going well, so far.
Yeah, there's definitely some in there.
Tim's optimistic she's ready to mate, but first he's hoping Dr. Robin will confirm that she's fertile.
You can see.
Yep.
They're eggs.
Okay.
Oh, she's got to come down. Whoa.
This is excellent news because really they're not very often bred in captivity. And if she's ready and Kraken's willing to do the deed, then hopefully we'll have success.
Wow. These little black circles are eggs?
Correct.
And is that real size?
That's real size.
They're that big?
2.9 to 3 centimeters. They're quite large. And you can imagine what size they are when they come out.
That's 1, 2, 3, 4, 5, 6, 7?
6, 7, maybe even 8.
So that is exactly what we're after.
That's what we want to see because that means she's ready.
Yeah.
There are very few Komodo dragons born in captivity and only 6,000 left in the wild. So Tim is wasting no time teaming Daenerys with a mate and hoping for success.
It's critically important that we try and breed Daenerys. One of the leading causes of death in Komodo dragons in captivity is egg peritonitis. Now, that is when the eggs are inside, they're not fertilised, she didn't breed, but they sit there. They can rupture, they become infected and cause death.
Yeah, I'll take Kraken out onto the grass. We'll stay out there for a little bit.
He's at the door.
He's ready to go. I can hear him scratching. He's excited.
And here's the man of the moment, a hefty 70-kilo male called Kraken.
Now, while he's walking, we'll let Daenerys into Kraken's enclosure, at which point we'll bring Kraken back. You can see her. He spotted her. An introduction is very delicate. She's going to test him. She's going to want a male to follow after her. At that point, it can go really good or it can go really bad. That's what we want.
He sounds like he's being tortured.
Yeah.
It's pretty distressing.
Kate is witnessing firsthand how distressed Bruce becomes when he's left alone.
I've heard enough.
Okay.
Let's put him out of his misery and let's go back inside and have a look at this video footage. And then I'm going to give you guys some strategies on how we're going to manage this.
Oh, I'm nervous.
Hey, buddy. We're nervous about seeing the footage, but at the same time, we're hoping that this is the start of the solution. Yeah.
All right, let's have a look at these.
All right.
Here it comes. Oh, Bruce.
He looks so sad and distressed. I mean, I cannot imagine what he must be feeling as well. It's heartbreaking. It's hard to watch.
Oh, he's going back. Oh, he's doing it. He's just searching for a way out.
He's looking for all the points that we come from. He looks at our bedroom window. He goes to the back door. And you can really see he's just frantically looking for us. And it's just, we've been taken away from him. And we can't go on like this. Bruce can't go on like this.
It's horrible.
I think we've all seen enough. We know what's going on and how bad this is. Bruce can't keep going like this.
Come and have a look at this.
Whoa.
Yeah.
On the Gold Coast, Alex just x-rayed Simba the cat, and she wants to show her partner Gerardo her extraordinary find.
I've got to say, I did not expect that. My biggest worry is how are we going to get this out?
Simba has swallowed his owner's expensive Tiffany locket, and Alex is concerned he could be poisoned if the metal pendant starts to corrode.
I'm seeing one huge challenge with getting that out. With this, all this food.
That's going to be an issue.
Simba urgently needs an endoscope, but the special camera will struggle to locate the locket with so much food all around it.
If that locket moves out of the stomach into the intestine, it's too late and Simba would need surgery. Okay, let's go and tell her the news.
Simba's worried owner, Amina, has been waiting for news about her cheeky cat burglar.
Hey, Amina.
Well, when I heard that he swallowed the locket, I absolutely couldn't believe it, but it's something that he would do. I was scared, like, what if he dies? I don't know, I was just so anxious, I started crying. Like, if something happened to Simba, I don't know what I'd do with myself. I just care about, like, that he's okay.
Sorry, Simba. I know, sweetie. Sting, sting. Good boy, I'm sorry. The first thing we're going to try with Simba is to induce vomiting. There's a small chance the locket will come up, but I'm hoping we can remove at least some of that food.
The drug also makes them sleepy, so it is also possible that he might just fall asleep.
Now it's just a waiting game to see if Simba will vomit with this drug that we've given him. It only works in about 30% of cases, so there's a more than even chance that he's not going to vomit, but it's worth a try. Oh boy, you're okay.
As the minutes tick by, Simba isn't responding.
All right, we'll have to go to plan B. As I expected, no vomiting and a very sleepy Simba.
The plan now is to put the camera down into Simba's stomach to see if they can locate the locket.
Just going to induce anaesthetic now. So we need him asleep for this before we put the camera down into his stomach. This is going to be a two-man job. I'm going to position the scope and Drado's going to drive.
Okay.
He's got skills back from playing video game days, so I think he's got the best chance of getting this out because it is not going to be easy.
Okay, here we go.
I'm going down.
Fingers crossed we can grab that locket and pull it out. In the esophagus. We're heading down towards the stomach.
Oh, he's awake. Whoa, 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 whoa.
Suddenly, things take a turn for the worse.
Quick, 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 quick.
Oh, yeah, okay. All right, sorry, mate. So, he's quite sore in there today.
12-year-old Buddy is having trouble walking, and Danny needs to find out why.
Oh, sorry, Papa. I'm a bit concerned because we've got a lot of muscle wastage in both of these back legs. Potentially something going on in the left back leg as well. So we're going to get x-rays of that today, just to make sure we're not missing anything else. And that will affect our plan going forward as well. Hey, mate. All right, mate, just going to give you a little jab, okay? Very brave.
Boy, I know. Very good.
Oh, such a brave boy, hey? So I'm just giving Buddy a little bit of sedation because we do want to have a good feel of that right knee joint to see what's going on there. So the sedation should just take the edge off so that he's more comfortable. Okay, just a little clipper. All right, mate. Good boy. Hey, Buddy.
Gentle Buddy's been the perfect patient until now.
Buddy's become a little bit stressed and anxious, which isn't surprising. Certainly animals do get very nervous when we're trying to do things to them. They don't know we're trying to help. So I want to just back away, give him a little chance just to settle into that sedation, and we can rethink how we're going to approach this just to avoid any unnecessary stress today.
Some quiet time in a darkened room can often help distressed animals to relax.
I have a feeling we're not going to need any more sedation. Hey, mate?
It's certainly done the trick with Sleepy Buddy.
Just got this catheter in just in case we do need to give him any further sedation. Okay, just a little sting, mate. Okay, good boy. And also, obviously, if anything takes a turn for the worse and he needs his sedation reversed promptly, we can do that quickly. Hey? Okay, all set.
An X-ray will give Danny a clearer picture of what's going on with Buddy's troublesome legs.
Because Buddy does have a lot of muscle wastage in both of those back legs, it is really important that we get some x-rays of both the knees and the hips, because there could be a few things going on that could explain why that's occurring. And certainly if there is something sinister like a tumour, we will be able to pick that up. All right, x-ray. Beautiful.
Danny's desperately hoping Buddy's lameness isn't due to anything sinister like cancer.
Here we go, mate. So I'm having a good feel of that knee joint, and I can feel a lot of laxity there. X-ray. So that certainly says to me we've got some issue with the cruciate ligament. I'm gonna cover on your little pillow, hey? Oh, hi. Good morning. But if there is a tumour there or a cancer in the bone, it may mean that he has to have his leg amputated. You just relax for a bit, mate, hey? You just relax.
At the Australian Reptile Park, Tim's hoping love is in the air in the Komodo dragon enclosure.
They've sized each other up.
Female Daenerys is fertile, but is she ready for the advances of male Komodo kraken?
Now, the chase is on. She'll keep running until he can catch up and show her the male that he is. Kraken's showing a little bit of frustration. Daenerys' skin is very thick, but it's no match for Kraken's teeth. Oh, that's heating up a bit. Yeah, we don't want that.
Tim may have to intervene.
Kraken's starting to worry us. He's bitten Daenerys right across the face. That's not a good position. Kraken lets go. No harm done. We've got a little bit of blood on one of Daenerys' brows. Kraken's fumbling around a bit, trying to pull her into a position where he can go into a mount.
That is incredible.
And he's in mount position now.
That is perfect.
It's looking good.
He's gonna mate.
Oh, wow.
After many years of looking at these dragons from just this long to the size they are now, we've got our first mating.
The next few days, we just expect multiple copulations.
Could be our first ever clutch of Komodo dragons.
Oh, he's awake. Whoa, 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 whoa. Quick, 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 quick.
On the Gold Coast, cat burglar Simba has suddenly started to wake up from his anaesthetic.
Give me another needle.
Alex and Gerardo are trying to retrieve a silver locket from the 2-year-old cat's esophagus.
Heart rate doesn't even change.
After a few tense moments, Simba is fully under again, and the hunt can continue for the missing locket.
Looking good.
Unfortunately, Simba's full stomach is making the search difficult.
Like rice soup, and we got to go snorkeling through it. Yeah, this is not a good situation at the moment. We've just got zero visual on anything except for a whole heap of food in the stomach. It's making it really hard. We can't find this locket, and I'm worried it's moved out of the stomach and into the intestine.
The decision is made to quickly do another X-ray in the hope of pinpointing exactly where the locket's located.
So it's sitting on the right side.
So it's in a
At least
TV
it's,
position.
at least it's still in the stomach. Simba's now been under anaesthetic for a long time, and the longer he's asleep, the more chance of complications. All right, back in. Just holding on. Yeah, that's why.
Okay.
Whoa! Oh, yes, you have! I got it!
Finally, the team's in luck.
Hold on to that thing.
God. All right, you do not let it go.
Not let go, Amelia.
This is one of the most complicated endoscopes we've performed. It's taking every member of the team to do this.
Okay. It's in the esophagus. Yep.
Okay.
That's it. Oh my.
Oh, yes.
Wow. It is a locket too. I still can't believe that a cat would swallow a metal object that large. That was an hour and a half, and in the end, it paid off, and it's out. Cuddle you up, mister. Lick you up. We're just going to move Simba into ICU for recovery, just because he's been under anaesthetic for a long time, and some of the food's come up his esophagus, so we need to watch him really closely and protect his airway.
Today, mobile vets Audrey and Alison are making an unusual house call.
All right, let's just grab all the stuff we need and get in there. Yep.
They've had a call from Edie to check on her 4-year-old Macaw, Skittles.
Hello. Hi, Edie. Hi. So our first impression when we see Skittles is that she is absolutely massive. Much bigger than we initially thought.
Hey, Skittles. How are you going?
Handling the tricky patient is definitely going to be a 2-person job.
You got your wild eyes on today. You know what we're here for.
Macaws have dangerously sharp claws and powerful beaks capable of splitting open hard nuts, so the girls need to be extra careful.
Oh, no.
My little munchkin.
Skittles was given to Edie as a 60th birthday present, and the two have formed a special bond.
Yeah, got your confidence back?
It's almost like mother and daughter. She absolutely loves this bird, babies it, and you can see that connection.
What would you like to watch? People thought I was crazy by getting this bird, but she's just brought so much joy into my life. The typical day with Skittles would be when I come home from work, we watch TV together for hours.
I think we should try and make friends before we go for the nail trim.
Good idea.
While most girls love a manicure, Skittles is playing a bit hard to get.
So we've got to get Skittles off her cage. She seems a little bit weary of us.
Look, Skittles, what Auntie Alison got for you.
With having people around, I think she's a little bit hesitant. I think she's just cautious.
Yes.
We've got to come up with a plan.
Maybe Mum can give her a cuddle and we'll pop a towel over the bitey end.
Yeah. Come on, no, don't whine. She came from a very, very busy house where there was a lot of action, and I think she didn't really like it. Oh no, she doesn't like the towel. She knows what that means.
So we eventually managed to get Skittles down from the cage. Mum's got her wrapped up in a towel just like a little baby. Alison's distracting the bitey end and I'm going in for the claws.
It's all right, my little girl.
It's good.
Right, you're a good girl. Look, oh, if you're a good girl, we might even paint them.
And just be careful of her quick at the back. You're being very good. You're being very
she's
good.
A good girl. Oh.
I know, Mummy's right there.
So you do have to be a little bit careful because she's got the black nails. So there is a quick that lies underneath. So if you trim that, it can bleed.
Yeah.
So I'm just taking the very tips off.
Done. There you go.
Oh, good girl.
Hi, Chicky.
Audrey has finished the claw trim without losing any fingers. And now Audrey is going to do a quick health check.
You want to have a look at Auntie Ellie while I feel your chest? That's a good girl.
Her little heart's beating.
It's beating very fast. That sounds good.
So what you want to feel here is her keel. So that should be a lot more prominent. And there is quite a lot of kind of fleshy mass beside it. And it's quite hard to feel her keel bone. So I would say she's a little bit on the overweight side.
Skittles can be quite a guts. I don't think she passes the chance to eat anything. That's her favourite treat.
So Edie's got a bit of work to do to try and get Skittles' weight down. Maybe it's a combination of too much nuts and too much television. Other from the little bit of extra weight that she's carrying, she's pretty good. Her heart sounds fine. I'm quite happy with her general health.
Well, I think we know who you love more, hey? The one who doesn't clip your nails or listen to your heart, hey? Hey, beautiful.
I'm sorry. I'm sorry. It's okay. You just relax for a bit, mate, hey?
In Melbourne, Danny's been trying to find out why elderly Buddy is having trouble walking.
Right, let's have a look at these x-rays. Fingers crossed for the best case scenario for little Buddy. All right.
She's hoping Buddy doesn't have something sinister.
So we've got his right knee here, so this is the problem one. And I am not seeing any changes in that bone to suggest there's any cancer there, so that's really good. Yes! I am seeing some swelling in the joint, so that makes sense with what I was feeling as well. And there are lots of little bony changes around the joint that suggest arthritis that makes sense as well. So considering that soft tissue swelling and what I'm feeling when I manipulate that knee, I'm pretty confident that we have fully ruptured the cruciate ligament, but it is a good scenario, believe it or not, I guess, for him. So this is actually the best case scenario for Buddy. Does mean he's going to have surgery to sort out that cruciate, but he is cancer-free, and best news is he gets to keep his leg. What a relief.
I know. He's such
Good on you, Buddy boy.
Danny's excited to break the news to worried owner Hayley.
It's been a big day for Buddy today, but he's done very well. He's a little superstar. So we've got all the x-rays and everything that we needed. I did have a good feel of his knee under sedation as well. And the good news is there is no cancer. There's no tumour. And I was a little bit concerned, considering his age and being a Labrador, that there could have been something there. He does, however, need to have some surgery. He has ruptured the cranial cruciate ligament. Okay. So is that something that you're able to go ahead with for Buddy?
Yeah, well, we have spoken about it as a family, and yeah, we're definitely going to get surgery done.
Oh, wonderful. There's a great prognosis with it. They do respond really well, so I think he'll be a much happier boy with that.
Yeah, he's a big part of our family, so we want to see him happy.
I bet he is. He's such a little character.
He is a good dog.
He's a puppy in an old man's body. Good. Yay. So yes, good result in the end.
Perfect.
Yeah. Great. Wonderful. Well, how about I go get Buddy then? Wonderful. Okay, bear with me. I'll grab him now. Hey, Buddy, little family. Hi. Oh, now, I've given him an arthritis injection, so that should help make him feel a little bit better. And we've got those anti-inflammatories that we'll continue with in the meantime, okay? That's beautiful.
Good. Thank you so much.
Alrighty, guys. Well, all the best. We'll see you very soon.
Yes,
okay?
we will. Thank you again.
See you later. Bye, Buddy. Bye.
Hello, Bruce. How are you? These are for you, but we'll talk about them with your mum and dad in a minute, okay? Just a minute.
In Bondi, Kate's back to visit rescue dog Bruce, armed with some tips and tricks to help him overcome his severe anxiety.
Good boy.
When you think about how Bruce must be feeling, he is suffering. He has got massive, massive anxiety. He would be like spending his whole life worrying that someone is going to leave him. This is a quality of life issue for Bruce, and we need to solve this for him. The most important thing to remember, work on your basic training. Bruce has never been to puppy school. He has no idea how to sit, stay, wait, any of these really basic things that dogs of Bruce's age need to know. So we need to start there. So dogs learn hand signals faster than they will words.
Yeah.
Use a hand command when you use a word. Okay, ready? Wait. So good, Bruce. So good. The second part of this is, as soon as you walk through the door and he jumps all over you, no attention until such times as you feel like he's quite calm.
Okay.
The other important part of this is no attention 30 minutes before you leave. That's the time that you need to start ignoring.
Right. Okay.
So this is a snuffle mat. They look bizarre, but they're very helpful. And what you do is you hide treats all in here, right? And he has to snuffle around and try and find all of the treats.
Good boy.
Okay.
Really what we want to do is keep him occupied for that 30 minutes after you leave, right? Because that's the window that he's so anxious. Bye, Bruce. That's going to take a little while to get to a point that they can actually leave the house, but it may mean they can actually go to the toilet on their own. was a total success. Bruce loves food and he loves that snuffle mat. And every time we do this, we just increase the amount of time that we leave for just that little bit longer. And over time, Bruce will realise that people will come back.
So good. That was a really good first start, you guys. Well done.
Yeah, very good. He likes that.
So good. You might even actually be able to get him to do this on the outside by tomorrow.
Nice.
This is not a short-term fix. This is going to be something that we have to manage for a long time, and it's going to take a while to get us on track.
There's also a genetic component.
Okay.
And the only way we're going to be able to have a chance at changing that is by using medication.
Yeah, right.
Just because he's on medication doesn't mean he's going to stay on medication for his whole life. When we see an improvement and we think we're getting there, we can start potentially thinking about weaning him off.
Okay.
And we know that it's not going to be easy and it's going to be challenging, but we're both prepared to make sure that, you know, we stick to a good plan that's going to make him really happy ultimately.
Okay, remember, not a fuss when you leave like I just did.
Yes.
I'll see you later, alligator. Good boy.
Hey, little man. Looking a bit sleepy.
At the Gold Coast Emergency Hospital, Simba the cat burglar has fully woken up.
Hey, you gave everyone a fright. Hey, but you're looking good. You woke up okay.
So Simba's looking really good. He's recovered fine from the anaesthetic, and I reckon we'll be sending him home tonight.
Alex is excited to reunite Simba with owner Amina.
Look who I've got here. Very happy boy to see you.
Oh, I'm sorry. Are you okay? I've got something for you.
Amina's also getting back her missing locket.
It's actually from an ex-boyfriend. I actually asked him, like, do you want me to give it back to you? And he said no, and I kept it because it's beautiful. Like, it's Tiffany. Like,
yeah.
You can throw away Tiffany.
Oh, yeah, the source of so much trouble.
Pretty much.
I'm sure he's going to get lots of cuddles tonight.
Yes.
See you, Simba. That's the first time I've ever taken a heart out of a cat, and I'd say that was pretty successful. Well, you stay out of trouble, Mr. Hay.
I can sleep soundly now.
That is incredible. He's in mount position now. That is perfect.
The love match between Komodo dragons Daenerys and Kraken didn't go quite as well as expected, with no baby dragon to report. But Tim is hoping for better luck next time round. As for elderly Buddy, his cruciate repair surgery went well and he's made a full recovery. And cat burglar Simba has also fully recovered after the ordeal to remove a Tiffany locket from his esophagus.
When Simba first came home, he wasn't eating much because his throat was hurting. But after a few days from the hospital, he was such a naughty boy, like up to no good. Like he walks around on shelves, he knocks things over. He just gets so excited. And every single time we eat dinner, he's always at the couch waiting.
Expensive jewellery is now definitely off Simba's menu.
Zeus, was that right?
Zeus, 3-year-old.
On the Gold Coast, an emergency patient has been rushed in to Gerardo. It's a badly injured 2-year-old greyhound called Zeus.
Zeus was brought down to us because he was racing around the track, he slipped, and they think he may have broken his leg.
So one of the nurses there has been able to wrap it up for us.
She did a pretty good job. Luckily, there were some vet nurses there that were able to stabilise his fracture with a splint.
Just worried because he was going into a bit of shock.
Get some pain relief for him, we'll make him feel more comfortable. Hey, Zeus, it's okay, mate. Good boy. That must have really hurt. He must have been hooning down around the track. These guys run so fast.
Owners Christina and Howard have had the rescue greyhound for just 1 week.
Zeus is the most docile, friendly, beautiful nature dog. He's a dream dog. He loves to run, but then on a corner, he fell and, well, was hanging, so.
He seems okay in his back legs. Just gonna check his other front leg. That's right, that pain relief will be kicking in soon, mate. You'll feel a lot better soon.
Zeus needs urgent x-rays.
Greyhounds are pretty robust creatures. They're designed to run fast, but when something goes wrong, when they fall over, they hit at high impact, so things can be disastrous. One of my biggest concerns is he may have shattered that bone beyond repair. Can't imagine how fast you may be running.
We'll see you at 5:30. No worries, babe.
In Melbourne, Danny has a busy lineup of patients.
Hey, baby. Hey. You okay?
Steph has just arrived with 11-year-old Marley after a suspected accident at home.
Hi, Steph. How you going?
Good, how are you?
Good. What brings Marley in today?
So we've just noticed that she's cut open her little paw.
Oh, darling girl.
And it seems like the pad has come out.
Oh, no, darling. Did you see anything happen? Any trauma? Or
No, nothing at
sure?
all. Just
No.
came home and that's how it was.
Has she been using the paw at all?
A little bit, not too much.
Okay. And has she been well otherwise? Haven't had any other concerns with her lately?
No, she's been absolutely perfect.
Okay, well that's good. I'll take her through and then I'll come and have a chat to you in a minute, okay?
worries.
Won't be too long. Come on, Marley. Come on. You're gorgeous. Oh, yes, it's looking a little bit dirty there, darling, hey? Oh, sweet pea. Let's have a little look there. Sorry, darling. Oh, ouch. Yes. Oh, that looks very ouchy, mate. It's strange, the paw pad feels really squishy and the tissue looks like it's split and then it's herniating out of that. It's just not looking healthy at all. And it does, I just want to have a look at the other paw pads and see if there's anything. Yes. Marley's come in today with a lacerated paw pad, but I'm having a look at the paw pads. They are all abnormal. They've all got this compressive tissue that's all squashy. So I think we've got something else going on here. So I think she's got a condition called pillowfoot, which is a plasma cell pododermatitis. So if you can see the actual paw pad is really abnormal. It's just squashing under my finger. It's not a nice, firm, sort of dense structure anymore. So I think that's then led to the laceration. And now it's just how we manage that. I'm not loving how well that's going to heal. Poor Steph, this is going to be quite a bit of information overload and a shock because Marley's come in with what looks like just a simple laceration, but it looks like there's also some more serious conditions going on here, possibly feline AIDS as well, so it's a lot to take in. I don't like the chances of it healing without surgical intervention. Oh, Marley, darling, I'm sorry.
Oh,
Is he just
wow,
there?
oh
Just
my.
there, just there.
He's up in
Here, and he got up again. That's when I got a shock and dropped the camera.
Oh, he fully rolled, didn't he?
A trip to the park has ended in a dash to emergency for the devastated owners of 2-year-old greyhound Zeus.
The next step is obviously we would take him to x-rays. The big unknown is how severe the fracture is. So
That's understandable.
yeah.
Gerardo's worried the young dog may have shattered his front leg beyond repair.
Hello. Zeus, oh, he's the most friendly, beautiful nature dog.
He looks really comfy now, doesn't he?
Yeah.
What we're going to do now is place an IV catheter, start him on some fluids, then we're going to do an anaesthetic and take him to x-rays. Good boy.
Best patient ever.
Yes, he's been a very boy. He's not even moved.
No, he hasn't.
The most important thing we need to determine is how bad that fracture really is. It's time to find out what happened, hey? The worst case scenario is the fracture is in multiple pieces and it could be too difficult to repair. Okay, well, they did a good job.
Quick-thinking nurses at the park were able to apply a makeshift splint to Zeus's leg.
What do you think that is?
Which is a pen.
That's a pen. So what they did is they used 2 pens and it's formed a splint on either side of the fracture. That was really good thinking because that makes him feel a lot more comfortable almost immediately. How's it going? Is he okay?
Yeah, he's nice and stable.
Nice and stable, because once we take this off, he might experience some pain. Oh no. That is definitely broken. He's just removed the bandages and immediately I can tell it's completely fractured. He's broken both bones and his lower forelimb there straight in 2. Well, let's take an x-ray and have a look and see, hey? The other thing I'm concerned about is that I can see there's bleeding there, which means that there actually may be bone that has penetrated through to the skin to the outside. That is a big infection risk. X-ray. This must have been incredibly painful for Zeus. Oh.
Wow.
Yeah. This is not so good for Zeus.
This might be one for the specialists, I think.
Danny is starting to suspect Marley's lacerated paw could be due to an immune condition linked to feline AIDS.
They may need to remove that paw pad.
She needs more information from Marley's worried owner, Steph.
Hello, so I'm just having a little look at Marley. I was wondering, has Marley ever been tested for FIV before? Okay.
FIV, or feline immunodeficiency virus, severely affects a cat's immune system, reducing their ability to fight off infections, as well as increasing their risk of developing certain cancers.
Well, I might do that test today if that is okay with you.
Yeah.
Just want to get the full picture as to what's going on.
Yeah.
Okay, I'll get that done now.
No
Okay,
worries.
won't be long.
So I've come in with just a cut open paw, and to hear that it could be a rare disease is really, really scary.
I'm sorry. Very brave, very brave. Okay. What a brave girl, sweetie, hey? Well done. So we're just running an in-house test to see whether Marley carries FIV or FELV, which are viruses that affect the immune system of cats, and it can complicate healing and infections and things like that. So we want to make sure that that's not present. So we've got 2 red lines. So that means we are FIV positive, and that was what I was really worried about. That's not great news. So even though FIV is not a condition that's contagious to humans, it is easily transmitted to other cats through scratches and bites. So it's important that Marley's kept indoors, away from other cats, to avoid spreading that disease any further. Oh, what a brave girl, what a brave girl. I'm really concerned that because Marley is positive for FIV virus, we've got a condition in the paw pads. This laceration is not going to heal well. So we're just going to pop a bandage on to protect that wound there until we can get into surgery. So at this stage for Marley, I think worst case scenario is that she may need to have her paw pad removed surgically. So I'm really unhappy with how this paw is looking. So we're just making Marley as comfortable as we can today, but she's going to have to come back for surgery. Alrighty, darling, we've done what we can for you today. All right, sweet. You want to go back into your little home? You'll be in good hands, you will. Hey, you've got a mummy that loves you very much. It's just thrown me today because it should have been a really simple treatment, and it's just so heartbreaking seeing such a beautiful cat with this owner that loves her so much. I have so much going on. Oh, darling. You've got a bit of a battle ahead of you, sweetheart. It's not fair.
Go ahead, Kel.
Do you want to come down, meet me at the devil enclosures?
I'll be there in 30 seconds.
As well as running the reptile park, Tim's other passion is Aussie Ark, devoted to helping save the Tasmanian devil from extinction.
Here's your mum.
Today, Kate is visiting for some important health checks.
The Ark is a sanctuary for native animals. There's a whole lot of protected species at this one place, and it really is a magical place.
Welcome to the Ark.
Hello, Tim. How are you?
I'm good, thanks. How's the drive?
Oh, gosh, it's so beautiful up
Beautiful?
here.
Yeah. We've got a busy day for you.
We all start being a vet because we love animals so much and all we want to do is help. Wow, look at this. Hello there, little guy.
Polly and Edward.
You have names for all of them.
All 200.
Do you really?
Yep. Yep.
Along with Tassie devils, the Ark is also home to a number of other endangered Australian animals.
So this is our native wildlife conservation facility, and there's a couple of thousand of Australia's most endangered mammals right there. I've asked Dr. Kate to join me at Aussie Ark for the day to administer treatment to a range of animals that have got injuries. Will we put you to work?
Yeah.
Watch the puddles.
What have you got for me?
Head over to quolls. Quolls are carnivorous marsupials, and there are 4 species of quoll in Australia. Every single one is endangered. So we've got 3 in here. We've got Quolline, Lars and Tim. And the one we're after is Tim. He's named after me. He's 4 years old. He's outlived life expectancy by about 1.5 years. We're a little worried about him because he's been observed to have an abnormality down near his bottom and just showing signs of old age. There's your tool for today.
Yep, great.
You won't be able to swat it like a butterfly. You'll have to let it run into the net. Okay, let's search.
These guys are super quick. Oh, and they're a little bit aggro. So we need to be a bit careful about how we do this.
We've got one under here.
Oh man, this is harder than it looks. These quolls are fast.
Oh, there he goes.
They are everywhere. Up the tree, down the tree, in the log, like it's all over the place. They're absolutely crazy.
Where'd he go?
Oh, this is hard, Tim.
Yeah, it's tricky. It's tricky. It's impossible to get your hand down and try and grab their tail. So we put a net at each end of the log that they're under and give the log a bit of a tap and hope that they fire out into your nets.
Oh, got it.
Turn it over, turn it over. That's it, you got it. And I've got the other one, 2 in 1.
There's one very angry quoll in this little bag. So Tim, in the grand scheme of quoll life, is very old.
Oh, he's 100 years old if you wanted to compare it to us. That's right.
Yep.
Yep, light brown.
Yep.
He's a big fella too.
Hey, buddy.
Just haven't quite...
Holy teeth.
Look at the teeth.
Yeah, I know, right? Tim is a really old quoll. He's well past his life expectancy date and he's got a little mass that Tim wants me to have a look at. I mean, just looking at this, and obviously without a biopsy, you can't actually tell whether this is a real tumour, right, a malignant tumour, or whether it's just a benign fatty tumour. But the reality is, in order to take a biopsy, you may as well take the darn thing off. It's quite a big surgery for an old quoll, right?
I don't think you'd make that.
I mean, I think that it's very stressful for an old quoll, right? And once he gets to a point that we feel as though you feel like his quality of life is suffering, and I think then that's the time to make some decisions.
Yeah. The plan with Tim is to ride it out, let him enjoy his old days without surgery and stitches and complications and unnecessary pain. Okay, mate. Well, you can go back in your box. We'll see you another day.
Next for Kate to check out is another quoll called Quolline. But will Kate be able to deliver the good news Tim is hoping for?
Now, let's just go and have a look at this pouch.
Might just...
Oh, God!
Alrighty, let's go.
Today, Alison and Audrey are swapping their mobile vet clinic for a Sydney rehabilitation centre. And a very brave boy called Chaz is on his way in with owner Anita.
Chaz is a blue heeler who 3.5 weeks ago was in a horrible accident where he was hit with a motorcycle. Hi Anita, how are you?
Hi, Chaz.
Hi Chaz. Oh, so nice to see you again.
Chaz is part of the family and obviously, you know, it's been very stressful. Yeah, it upsets us, to see Chaz like this. I looked out the window and saw him trying to run. He was on his front legs, but his torso was dragging and his legs were behind.
1-year-old Chaz underwent major spinal surgery, but still hasn't fully regained use of his back legs.
Obviously not being able to use those back legs is a learning process for both you and him.
Yeah.
And the fact that he hasn't got any deep pain, so that's feeling on the back legs, is a concern for long-term management.
Yeah.
The twins have started Chaz on an extensive rehab program to hopefully get him back using all 4 legs.
Let's just test the deep pain first, because that's something that he had initially that's now gone, and that's quite an important test. You
We can definitely feel that because he's tugging his back leg back.
So deep pain is when we're using my nail to press between the toes, and that creates a pain sensation. So we want to see if he can feel that and also react to it, so pull the foot away. And he's doing that today, so that's a really great sign.
Better than what we were expecting.
So now we'll do a patella reflex where we essentially use a hammer to press on the patella tendon or hit the patella tendon right there. I'm hitting quite firmly, and what I want to see is that his whole foot moves or it jerks in response to that. That's a really nice one. We just need to do the other side.
So I might just flick you over, Bubba.
Ooh. He has an amazing knee jerk reflex on both legs. So again, another promising sign.
The girls are also using acupuncture to help Chaz recover.
Okay, I'm gonna just put a point in the middle of the head between the eyebrows. I put one needle in the middle of his head, which is actually the calming point. I do this with all my acupuncture patients because it really calms them down, and often they'll fall asleep during the session, which is great. So the hope for these sort of treatments is that we get some feeling or as much function back on the back legs as we can. We know he's been up and down with his recovery. We started off with no pain in the back legs to now we've actually got some sensation back, which is really, really good.
Today, the girls are particularly excited for Chaz, with something extra special planned.
You're gonna love this, Chaz. I can't wait, it's so exciting.
That confirms that, 100%.
At the emergency hospital, it's not good news for greyhound Zeus.
Completely fractured through lower forelimb.
X-rays have confirmed Gerardo's worst fears.
We got some more x-rays and things just look worse. This is his right leg, this is his normal leg, and this is his left. And that's even possibly a piece of bone sticking out through the skin. This is a serious fracture.
The young greyhound is going to need immediate surgery with an orthopaedic specialist.
My job today is to stabilise Zeus, keep him comfortable, clean out the wound, and then get him prepared and ready for specialist surgery, because this is a fracture that I don't want to touch. I'm hoping that there's no bone poking through. Oh no, that is his bone. Now that we know it's an open fracture, our biggest concern is infection. So we're going to flush the area and start him on some IV antibiotics. Anyway, we can change the gloves and then we'll do the final flush in there, hey? Yeah. So what we're doing now is flushing the inside of the hole where the bone is, because there's exposed bone there now. The flush is really important because if we can get rid of any debris that's in there, then that will reduce the risk of infection occurring later. Bones do not like infection. Let's wrap him up, hey? Here we go, see if we can get this rolling. So what we're doing now is replacing a Robert Jones bandage. So it's a real thick layer of cotton, and then we'll compress this cotton down and it'll form a nice compressive bandage that will keep swelling down and stabilise the fracture at the same time. Sound like a watermelon?
Yeah, it does, yeah.
We know when it's right, when we can flick it and it sounds like a watermelon. It means that the pressure is enough. It's been a rough day for Zeus. He's got a significant fracture. It's going to cause him a lot of pain. My hope is that they can fix it. We've done everything we can for Zeus. Now it's time for the surgeons to work their miracles. You rest up, mate.
It's an extra special day for Alison and Audrey's patient Chaz. The brave one-year-old lost the use of his back legs after being hit by a motorcycle.
now we're going to see Reese from the Animal Rehab Clinic, and we're all excited because we're going to fit Chaz with a new wheelchair. So we've got to measure him up and see how we go.
We're just going to get 2 measurements which will help us find the right size for him. Firstly, we'll just get his leg height there, and we'll just get the length of his body just to his armpit. If we come back in a couple of days' time, we'll have the right wheelchair for him.
That's exciting. So maybe we'll give you some hydrotherapy now, see how you go. Good
Oh,
boy.
this is new and exciting.
Good boy. We'll walk him into the unit, fill the water up to about hip height. That will just give him some extra buoyancy so that we can teach him how to walk and help him place his feet.
So who's getting in the water?
You're getting in the water today, and I've got some exciting attire for you.
Okay.
You're gonna put this sexy number on.
Oh wow, I've always wanted to wear one of those actually.
Doing is giving him some proprioceptive and sensory feedback so that he's getting used to that walking gait again.
Oh, good boy, what is it?
He starts moving his front legs while I'm moving his back legs and supporting him. And that's quite exciting because for him, he's feeling that movement again, which he hasn't done for a few weeks.
You did really well today, Chaz, and we'll see you again soon for your wheelchair. That's exciting.
Now, let's have a look at this pouch.
At Aussie Ark, Kate is helping Tim with some of the precious endangered animals he's working to save from extinction.
Wow, look at this.
Can you see it already?
Yeah. So you can see down in here, you guys, what have we got?
Wow, look at that. Quolls only live for 2 or 3 years. If you don't breed for 2 years, you've lost your whole population. So every year at this time of year, our fingers are crossed, hoping to see those joeys.
A little joey.
Can you count them?
1, 2, 3, 4, 5, 6 of them, Kel.
And it is a full pouch. 6 tiny little, still kind of pink, a little bit dotted, ears folded down, eyes covered with skin. Beautiful quoll joeys.
And you can see this little face here, little ear.
Oh, there's an eye, a dark eye.
A little dark eye. This is a really special moment. These guys have been waiting all year for this moment, and they are so excited. I'm so excited.
They're all in great health.
They're in really good health. Well done, Mum.
The babies will stay in the mother's pouch for around 3 months.
The bit I always look forward to is heading off to the devil compound.
Oh, this is our enclosure. There's 10 males in there.
Yep.
They're all 3 to 4 year old, and it's Moose that we're concerned about. Moose is a 3.5-year-old male devil, and he's in an enclosure with 10 other males. He's lost condition, he's being bullied, he's super aggressive because he's overcompensating.
He's really angry.
And this morning, we found that he has a laceration on his tail. Yeah. So we're not sure if there's something underlying.
Yeah.
Or if he's just being bullied.
Hi, guys. How are you all? There is no way we are going to be able to catch Moose without a strategy.
See that stake over there? That's what it's got to go on to.
Okay, we've all got our jobs. Tim is behind, he's going to be the catcher, and I'm going to get all of these devils to attach to this bit of meat.
So you need to show them this rather than your leg.
Okay, sure.
That's the idea.
It can't be that hard.
Keep going. Oh. Keep going. You got to hold it out. Hold it out. Hold it out. Hold it out.
I'm holding.
Hold it out.
Good girl, Marley. We need to see how your paw's going, miss. Yeah.
In Melbourne, it's been 2 weeks since Danny diagnosed FIV, or feline AIDS, in Steph's beloved cat Marley.
You've got a bit of a battle ahead of you, sweetheart. It's not fair.
Badly lacerated paws were the first sign that something was seriously wrong.
Oh, that looks very ouchy, mate.
The little cat had to undergo surgery to help her paws repair.
I thought she'd just cut her paw open. I didn't know it was this big. I didn't know she had such a rare disease.
Hey Steph, how you going?
Not too bad.
How's Marley?
She's doing so well.
Oh, wonderful. I'm so excited to see how that paw's looking today. Hey? You want to come with me? Yes. You said yes. Let's see how your paw's going, miss. It's been a big couple of weeks for Marley. The first time I saw her, that paw was looking terrible from that laceration. Darling, all right, let's have a little look at you. Oh, so that is healing beautifully. It's not perfect. We have just that very superficial layer there has broken down a little bit, but all the deeper tissue has healed beautifully. I am so happy.
You've done so great, Marley.
Okay. So this is a really good result, considering she has a pretty serious condition going on in those paw pads. It is such a huge relief that this surgical repair of that paw has gone so well, because at one stage it was looking like we may need to amputate that pad, or in worst case scenario, her limb. So this is really a huge relief. We'll just have to keep an eye on that. You just have to keep on soft surfaces, my darling. See? Let's have a look also to see how these paw pads are doing, if they've improved at all. No, so it's still very soft. As far as Marley's pillow foot condition, they're unlikely to ever go back to normal. So the goal is to use medical treatment and management to get as much improvement as we can over time. Yeah, so it's just going to be about monitoring now and keeping those paws on soft surfaces and avoiding jumping from heights and trotting on sharp objects and all those sorts of fun things around the house. So how are you feeling? You relieved?
Yes, lots of relief. Yeah.
I bet. Well, it's just been an incredible result, and I am equally as relieved.
Yeah, I bet you are.
I know, the darling. She's just so sweet. We'll just keep an eye on those paws and hopefully no more injuries.
Fingers crossed?
Yeah.
Paws crossed?
Yes, paws crossed, darling. Okay?
Keep going. You got to hold it out. Hold it out. Hold it out. Hold it out.
I'm holding.
Hold it out.
At Aussie Ark, Kate's first close-up encounter with Tassie Devils isn't quite going to plan.
Let him on. Let him on. Kate doesn't have that food out in front of her. She's pulled it into her feet, which means she's got 10 devils around her legs. They want the food, but they will bite her leg.
This is hard. Where's the steak?
Okay, pass that to me.
Yeah.
Just jump behind me for a sec there.
Yep.
All I remember was Tim saving the day. He grabs that meat off me, puts it on the spoke, and I hightail it out of there.
Woo. How are you going?
That was fun.
I told you it would be fun. That's the fun part. So we'll let him settle for a minute.
Yep.
And then we'll grab Moose.
Look at this guy's teeth, absolutely enormous.
They've one of the strongest jaw pressures, pound for pound, on earth, and for crushing bone. So I'm going to grab him now.
Yep.
Oh, there he goes. Once he gets on. Okay, right?
Yep.
Come here, Moose.
Hey, Moosey. How are you, buddy?
He's not right. He's not happy. You got a bag there, Max? 1, 2, 3.
Hopefully Moose will calm down once he's inside the safety of the dark bag. Then it will be easier for Kate to check out his wounds.
Yeah, he's really been fighting with the other devils quite a lot. He's got a really big laceration to that lip. If a dog or a cat had this kind of wound, then we would be thinking that this was serious. But not overly worried about these wounds on his face.
Pretty superficial.
For a devil.
For a devil.
Now, let's have a look at this tail injury. It's not only just gone through that skin, but it's also gone through all of that muscle layer and really quite deep. I'm just going to give this wound a really good flush.
He doesn't like it.
He doesn't love it. Just clean that out a little bit.
Whilst Kate is doing her vet checks, Moose goes to the toilet. That's okay, it happens all the time. But after a couple of minutes, I noticed that there's a little white thing wiggling out of the feces. Is it a worm?
Yeah, it's a worm. That would go a long way to explaining why he's losing weight.
Down. Worms are a problem for devils just like they are other animals. They get into the gut and they consume all the goodness that would otherwise be absorbed by the devil.
So we've got a few factors going on here. So we know he's got worms. He's got all of these lacerations all over him, probably resulting on the fact that he's being a little bit picked on.
Yeah.
And maybe he's being picked on because he's actually starting to lose weight and he's become the smallest. So we're just going to put some all-wormer on his back here. And we're doing that just to cover him off against tapeworms and hookworms and roundworms and all those things that could potentially be causing him to lose weight. And let's also give him a shot of antibiotics. There you go, mate.
Done.
Poor little Moose is in pretty bad shape. He's little, he's skinny, he's in poor body condition.
There you go.
Good boy, Moose. But we can't right now just put him back in with the other guys. They are going to make mincemeat of him. He's got to go into a protected little sanctuary by himself. Keep a really good eye on him the next couple of days.
Yeah.
Keep an eye on that wound, feed him up, get him back to his fighting weight.
Yeah. Well, he's happy. Thank you for coming up today.
Thanks for having me.
It's a long way, but it's always worth having a vet visit the Ark. It's great, all the animals are sorted, and I hope we don't have to see you again too soon.
You know where to find me.
Yeah, thank you.
What do you have there?
Look at this little guy.
Oh, wow.
He's beautiful, hey?
At the emergency hospital on the Gold Coast, an unusual little patient has just been brought in to Alex and Gerardo.
Poor guy. Chap found him caught in the barbed wire fence. He's actually he managed to cut him out, but he's actually still got some of the barbed wire.
Oh, okay, whereabouts?
Here, I'll show you. You see that?
Wow.
Yep. So he's actually got it twisted around.
Oh, you reckon this is webbing?
Yep. Sugar gliders and fences, they just don't mix. Unfortunately, it's something we see pretty regularly. These little guys are native to this area, and around the farming land in particular, there's barbed wire fencing. They're gliding along and they have a run-in with the fence, and it's just a really nasty situation for them, and often they'll die. This guy's really lucky that Good Samaritan found him, managed to cut him free, and he's at least got a chance. We're going to need to...
Anaesthetise him or something, what are you thinking?
Yep, get him asleep.
Yep.
And then try and remove it, but I don't know how much damage it's actually done to the webbing.
Yeah, that's very fragile.
Yeah. Pop him straight in, I think.
Yeah, whole thing, I think.
That way we don't have to handle him too much before he's asleep.
Alex and Gerardo want to act quickly to minimise stress to the little sugar glider.
This is an airtight sealed chamber where we can put anaesthetic gas in, and it means that we can slowly anaesthetise him without the stress of us trying to handle him. If we touch him too much or stress him out, they can die. Sealed. Once he is out of his cage and under an anaesthetic, then we can carefully assess the webbing and see if we can untangle the barbed wire from his webbing. Are you ready? 1, 2...
Hey, little guy. Oh, he's nicely asleep.
And they can wake up pretty quick.
Yeah.
His arms.
Poor little guy.
Let go, mate. You gotta let go. His claws are so good
He's
at holding on.
I think his instinct is just to hold on. So we're going to have to pry them off without trying to not do any damage. That wire's really clear there now. It's just right underneath him. You got him? There we go.
Got him.
Okay, just straight on there. I'll look after the anaesthetic side of things.
Okay.
We generally don't have masks that are small enough for this little guy, so we just fashioned something that's going to work. All we need to do is create a seal, so the anaesthetic, he breathes that in directly, but doesn't kind of go out into the room.
Oh.
No, that's not good. Just, how are we going to get that off? It's literally wound around the webbing, so we're going to have to figure out which way it's wound around and try to untwist it without doing more damage.
Oh, that's fully entwined.
Yeah. Poor guy.
In Sydney, it's a big day for young motorcycle accident victim Chaz.
Look, Chaz, there's your wheelchair. Let's try it out.
Audrey and Alison have been working with animal rehabilitation therapist Reese to help get Chaz mobile again.
He might not ever be back to full function on his back feet, but at least we're giving him the best chance. We're doing the surgery and having rehab here at Animal Rehab Clinic, and the acupuncture and hydrotherapy. That's going to give him the best chance to regain that muscle and function on that back legs.
So we're going to turn him around and get him to
back into that.
Sort of back into that, or roll this forwards, and then you can click that in.
It's all new for the brave 1-year-old, so Audrey gives some reassuring cuddles to help him relax.
What we've got for him at the back here, there's these nifty little devices, and then we can use this to adjust the height so we can lift his legs up nice and high as well. There you are, buddy.
Oh, look at him, look at it. Check it
You
out.
look cool.
At first, Chaz isn't too sure,
Oh, wow. He's like fully off there.
but he quickly gets the hang of his flashy new wheels.
So Chaz is now fitted with his cool wheelchair. He looks great. He's loving it.
Amazing.
It is amazing. I've never seen this before. I think this is amazing.
Good work, buddy.
We can't wait to get him out to the waiting room because we've got a bit of a surprise for him.
Hello! Hi, Chaz! Hello! So we bring Chaz around the corner and there waiting for him is his entire family. We've got Stella, which is his wife, and his 2 new gorgeous 7-week-old pups who he's never met before.
Good look at you, Chaz. Hello. Hello.
For owner Anita, it's a dream come true after generous donors opened up their hearts to her special little boy.
Both my kids and my son's girlfriend organised the GoFundMe page. It's just so much support and love and kindness from a lot of people, and it's been really, really great. So we're very grateful.
Chaz, you ready to go? Ready to go with your new wheels. Bye.
All right, let's go. See you later. Bye. Bye, puppies. See you in a few days. Oh, you don't want to go.
See ya.
Okay, I'm just going to try and work out which way it's winding around because and that's actually helping to have that little bit of fluid. So if you just add, yeah, that's good.
Alex and Gerardo have started the delicate procedure to try to remove barbed wire tangled around a little sugar glider's webbing.
I almost have to impale it from the end of that spike there.
Yeah.
I think we really just got to see.
Is that another barb just there? Maybe we feed it off this. There we go. I think we just got to pull it off.
Yeah, got it.
There
Good job.
we go. When they jump from a tree, they can glide for up to 50 metres. So if there is too much trauma to one side, he might be off balance. He may not be able to fly ever again.
It's not going to be how it was,
Yeah.
but there's enough webbing there that I think he's got a good chance of being able to glide. I mean, it's bruised, but we can't say for sure, so we really just have to give him some time.
We don't know how long he's been stuck there for. He may have been stuck on the barbed wire fence for days. He feels a bit thin, so we give some fluids that'll help rehydrate him.
From here, he'll go to the wildlife hospital, and over the next couple of days, they'll see how much of that webbing is viable, and then it's really whether there's a chance of him going back into the wild or whether he'll need to stay at the wildlife sanctuary for good.
So,
What have we got there?
we've got his fluids,
Yep, under the skin.
anti-inflammatory, and this little teeny little thing is this antibiotic.
That's such a tiny dose.
Oh, he's so light, it's only 150 grams.
I'm just feeling that a little bit.
Oh, little matey, it's okay, it's okay. There we go.
Okay, get him into his bed. He's almost awake. So we're just going to pop him in his little bed there. We'll probably put a little bit of heat on just to keep him warm and pop him in the ICU, and they'll keep a good eye on him until the wildlife hospital come pick him up.
Hi, Chazzy.
It's been 4 weeks since motorcycle accident victim Chaz was fitted with his new wheels, and Audrey is excited to catch up with owner Anita to check on his recovery.
We're doing our own rehab with him at home, exercising him every day, every morning, try and bring him for walks or runs. He's not as mobile as any other dog, but he's doing pretty good.
He looks good. How's he
He's-
settling into his wheelchair?
Loves it.
Loves it?
Yeah, he's comfortable.
And he loves his
wants
little
to go.
goodies?
Yeah.
It's been 4 weeks since I've seen Chaz, and I'm so surprised with his improvement. He looks so happy, he's full of energy, he's not even worried about the wheelchair on his back. And I
Okay,
can
so
see
dress.
there he's moving his back legs on his own, which is great. I mean, he seems to know that they're there, and even when we're just tickling the back of his feet, there he
Yeah,
goes
he's
kicking
moved.
away. That's a huge improvement from when we saw him last.
Yeah,
Huge.
every day he's improving.
Yeah. I'm actually quite surprised with Chaz's recovery. He's recovering a lot faster than I thought he would. He's getting feeling back in that leg and he's moving it on his own. That's quite a significant improvement in such a short time frame. You want to go for a run? Ready?
Ready?
Go! Dogs are amazing. They'll always surprise you.
Good boy.
Bring it back. Sometimes they'll go through the biggest surgeries and they're just happy. They're just happy to be able to walk, run, play, and you can see that all over Chaz's face today.
Ready?
Go! It is slightly toe touching on that left, so that's why he's moving it as if he's using it. So you can probably drop that right one down a bit.
Yeah. Good boy. You're bringing it back for a change.
I know. It's always hard to say how these dogs are going to go. It's such a big surgery and such a major injury. Obviously, we want him back to walking completely normally, but even if he's just walking, I'd be happy with that. He's come so far, week by week, the progress has been amazing, so very hopeful.
He's happy though, isn't he? Like you
So
can see
happy.
his spirit.
You wouldn't even, yeah. It's just so nice to see him happy.
Oh, hello, aren't you gorgeous?
As for Marley, her badly lacerated paw has healed well. Feline AIDS is currently not affecting her, but Danny will keep a close eye on the special little girl into the future. The traumatised sugar glider that was tangled in barbed wire fully recovered and has been returned to the wild.
It's all right, mate. You'll feel better soon.
And it seems nothing can hold back adventurous Zeus. The rescue greyhound's shattered leg has healed well. He's looking forward to gentle walks in the park as he continues to recover.
Good boy, mate.
And how you doing?
I feel a bit frazzled. Could be a tumour or something, but I don't really want to entertain that thought until I'm faced with that in front of me.
In Melbourne, vet Danny and partner Will have had an extremely distressing morning with their beloved dog Bear.
It's okay, Bear, it's okay. Oh, pup. Will, my partner, woke up to a banging sound. And I've just seen Bear just in the middle of a grand mal seizure. So she's just paddling and in a real tonic sort of state. It's just the most horrific thing to see happen to your own animal. I think there's something different about it being a patient in a hospital setting, everything's so controlled, you know what's going on, you know, you've got all your medications there, everything to act, but when it's your own animal, it's just so much more emotional and distressing. A huge shock because this is the first time this has ever happened. Hey, you okay? You're okay. It's come out of the seizure. She's not neurologically normal yet. She's pacing around, she's panting, she's wanting to drink a lot. She seems really ravenous. She's hanging around the fridge. Just want to see how quickly she sort of gets through this phase and recovers.
Hey. Sit.
She's got a calm pup.
Sit.
3 hours later, the signs are promising.
What have we got here, Buzz?
Hey.
Bear's still slightly agitated, but much to Danny's relief, she's almost back to her old self.
Bear is full of energy, full of love. She loves every human she meets. You got it? You got it? She's just our best mate. We just want to have her with us all the time, wherever we go. She's the best company.
Good old Bear, she's back.
Will's also relieved. Big, gentle Bear has helped him through some tough times.
I got her as a puppy. She's been great for me after discharging from the military a fair few years ago now. She was a great companion, so that's been great.
But Danny is still anxious to get to the bottom of Bear's sudden early morning seizure.
Of course, my emotional brain is just leaping to the worst case scenario. The first thing I'm worried about is that she has a brain tumour. So, yeah, we really just need to get more information to know why this is happening.
She'll be right. You've had a big
We will get to the bottom of it. We will get you sorted. She's my baby. She's everything. You hear me, Bear? We're going to get this sorted.
On the Gold Coast, Alex is on duty when a 3-year-old cat is rushed in.
Hey, this is Max.
You're okay, Max.
Oh yeah, he's in a bit of a panic.
Max belongs to Christy's son, and she's alarmed the much-loved rescue cat is extremely agitated and struggling to stand.
He spent last night outside, which he doesn't always do, but he wouldn't come back in when we went to bed.
Okay.
So he normally is on the table when we wake up in the morning.
Yeah.
And he was, so we let him in and he went straight off to sleep. And then he woke up a few hours later and he was all like drunk and hit the back. So it was all like he had no movement.
Wow, so really wobbly.
Yeah, and then just weed everywhere.
Gosh, okay. You're all right, mate. You're all right.
Okay, Max.
Now, they said they do live on acreage, so their big concern is, has he been bitten by a snake or could he have a tick?
Tick, yep.
So I think the first thing we can do is just go over him, see if we can find if he's got a tick there, and then, yeah.
Hang on, Max, hang on.
And then I'll go back and have a chat to them. Oh, it's all right, mate. He's having a bit of a panic there as well. He's not walking properly on his legs, that much we do know. And this time of year in this part of the country, biggest concern is always that he's got a tick, because it's really, really common, and they'll present exactly like this, where they just can't walk and they're staggering all over the place, and they really get quite distressed, and he's really getting stressed now. We might even, we'll have to get him back in oxygen. Yeah, we're actually gonna pop him in a bed because he's just panicking at the moment. And when they're this stressed, they can just get into trouble so quickly. You just relax. Good boy. All right, Max. That's it. You just relax. You just chill out for a bit in there, mate. Have some oxygen, and we'll come back to you in a few minutes. I get really concerned when cats get stressed like that, regardless of what the cause of Max being here today. If he gets stressed, if he's not able to breathe properly, they can get into real trouble and they can even stop breathing. So the one thing that we need to do is just get hands off and leave him to breathe in some oxygen, chill out for a little bit, and then we'll start looking for a tick again. If there's a tick there, it's really important that we get it off as soon as possible, but we've got to weigh that up with, are we putting Max in more danger by handling him at this stage?
She'll be right.
In Melbourne, it's been a distressing few hours for vet Danny and partner Will.
We will get to the bottom of it. We will get you sorted.
They were woken by their beloved 6-year-old dog Bear having a seizure.
I've just seen Bear just in the middle of a grand mal seizure. Okay. A huge shock because this is the first time this has ever happened. All right, just sit down.
Stay.
Sit
Good
down,
girl.
shall we?
Stay there. Good girl.
All right, so I'll just check how well she's seeing
Yep.
things. Now the Bear has somewhat recovered from this seizure, I want to do a neurological examination. Good girl, puppy.
So what are you
she's
doing?
Seeing, essentially, she doesn't know this is coming, and she's seeing it drop in front of her face, but it's not got a smell, it's not got a sound or anything, so it means that she is seeing. So that's good. Hey, you're a good girl. Just checking that.
By checking Bear's reflexes and response to light,
Girl.
Danny can work out if there are any early signs of brain abnormality.
Good job, puppy doggy. Hey? All right, so I'm really happy.
Yep.
That looks all
Good girl, come
normal.
here.
Good girl, boys dog. Sorry. I'm sorry.
Was it fun?
I'm sorry. I am really happy with the results on that examination. I couldn't see any abnormalities there, so that is a good sign at this stage. So the next step for Bear is to get some bloods, just to rule out anything that's going on outside of her nervous system that could be causing these neurological signs. Fair enough. Oh, good girl.
You get the picture in your head that you're going to have a dog that lives for, you know, however long their life expectancy is. And then to sort of suddenly think, God, she could be gone in, you know, a matter of months, weeks, days, and it's not knowing, do we have more answers? Yeah, it's scary.
In you come. Good girl. This way. Good girl.
It's just a short trip to the nearby vet clinic where Danny works.
Hey, Lou.
Hi, Danny.
just brought Bear in because I want to get some bloods. She's had a seizure this morning.
Oh no, dear.
So I'm really not sure what's going on. I am hoping that it's just something like epilepsy that we can manage.
Yeah, of course.
But it's the first seizure, so we'll just have to get some, some information.
Definitely. Come on, Bear, up we get.
Oh,
yeah.
Vet nurse Louise is helping Danny take Bear's blood sample.
Alrighty, Bear. Good job, almost there. Very good.
Good girl, beautiful.
The findings will hopefully give Danny more clues about what's caused Bear's distressing seizure.
One of the hardest things about being a vet and a pet owner is when something does go wrong, you know what the range of things could be. From the simplest thing all the way to the most sinister. So it can be incredibly stressful, and I do get very clouded in my thoughts. I'm a bit nervous waiting to get those blood results. I'm really crossing my fingers that nothing comes up on them today. Good girl. I'm so sorry.
Hey, Max.
On the Gold Coast, Max is now much less agitated after spending a few minutes in the oxygen tent.
All right, we might have another go.
Alex can now start the urgent search for a deadly paralysis tick on the young cat.
Okay, let's have another go. If there's a tick there, I think we need to find it fast.
Yes. Time is crucial with tick paralysis, so vet nurse Tiffany is assisting.
Oh, actually, there it is. I think I found it. Wow.
It's right underneath him there.
Come here, sweetheart.
Good boy.
Alex has found a huge tick at the top of Max's back leg.
Good boy.
You're all right. Oh, gosh, it's quite hard to get off.
Good boy. Look at that. Look at that.
Wow, that's massive.
Yeah, that's been on there for a couple of days. Now we know what it is. I reckon we pop him back.
Yeah. Come on, darling, back to the oxygen.
This tick is pretty big. It's been on there for at least a couple of days. It's had a chance to suck the blood, and it's got to this size, and while it's sucking the blood, that's where it's injecting the poison, and that's what's done the harm. The most important thing now for Max is to get some sedation on board because he's panicking. We're going to get an IV catheter in, and then we're going to give him some tick anti-serum, and that's what's going to save his life at this point.
Toxins from a paralysis tick can lead to respiratory failure and even death.
I'm just starting the tick anti-serum now, so this is the anti-venom that'll go intravenously to help to neutralise the toxin that's running around Max's system at the moment. And this is a little bit of a dangerous time because he could have a reaction to this anti-serum, and so Tiffany's going to need to sit with him and watch him really, really closely, because if he has an allergic reaction, we need to stop this within seconds.
Those bloods there, are they?
Yes, we do have them there.
See.
There's those ones for you.
For Danny, it's the moment of truth. Bear's blood test results. Early this morning, 6-year-old Bear suffered a sudden seizure. Danny is anxious to rule out any sinister causes.
Okay, good. So there's nothing going on outside of the brain, it looks like, that could be causing that. So that's really good. Good. Thank you. Yay. Yay, Fuzzy Doggy. Good job, Papa. All right. We're not out of the woods. There could be something else going on, but for now, it is good news.
Some good news
Yes.
today.
Yes. Hey, give us a bit of a scare, puppy doggy. Hey, good girl, puppy. You good girl. Hey. It's been a big day, a lot of emotion. So now we're going to go home and try and have a relaxing night, and Bear is on the bed tonight with lots of cuddles.
Back home with partner Will, Danny is doing her best to stay positive and plans to start Bear on medication to hopefully ward off any further seizures.
One step at a time, hey puppy?
In Bondi, Kate is enjoying her daily walk along the famous beachfront with her much-loved golden retriever, Ben.
You're funny.
Kate runs the busy Bondi Veterinary Hospital, which treats up to 300 animals a week.
What I love about being a vet is the human-animal bond. They make us better humans. Beautiful. They teach us about unconditional love. Looking after animals that are sick and then nursing them back to health, the satisfaction that you get from that is the best.
Today, an unusual little stray has been dropped off to vet nurse Elizabeth.
What's going on here?
You'll soon find out. Let me show you. We get loads of weird animals at this clinic, but in Bondi I haven't seen anything like this before.
I'm intrigued, Elizabeth.
You are going to love this.
What have you got? Let me have a look here. This is different. Oh! Hello. How are you? Where did she come from? Oh! You've got an escapee chicken. Where did you find her?
Somebody found her down at the beach.
Down at the beach?
Down at the beach, on the road. The council have just brought her in.
Oh my goodness. Were you trying to cross the road? Why did the chicken cross the road? I have no idea why the chicken crossed the road, but he didn't get to the other side. I don't even know if Elizabeth knows that joke. So straight away, I can tell that you are a girl. This is a hen, not a rooster. And the reason I can see that with you is that your comb on the top is not as colourful as it would be as if you were a rooster. So you're giving me some clues.
Kate's now concerned the little stray may be hurt, especially if she was trying to dodge traffic near busy Bondi Beach.
And that she's in good health. Good. Bottom. All her legs feel like they're okay. Wings, looking beautiful. Just walk this way. Okay, good. Walking well. Well, she seems to be in reasonably good health, Elizabeth. She's very lucky that she hasn't actually been injured. I suspect, by the looks of her, that she looks like she has a home. Do we have any details, Elizabeth, about where she might have come from?
No, nothing.
Nothing. Let's make sure you weigh okay. 1.74. You're bigger than what we thought. She must be owned by someone. We just have to find your family. Where are they?
A familiar sight around Sydney is the mobile vet clinic run by identical twin vets Audrey and Alison.
I don't know what it's like to not be a twin, but it's definitely
the best thing ever.
advantageous.
Yeah, we work together, we have the same likes, we know what the other one's feeling. Yeah, and we're the other half of each other. Hey, Andrew.
Hey.
Hi, Paco.
Today, the girls are about to check a feisty cat that's been in the wars.
Last night we got an email from Paco's owner and it was a picture of Paco with lots of blood coming out his eye. So we were pretty shocked, keen to see him today and check it out. Oh, that eye looks sore. Come on in.
Owner Andrew is anxious about his special mate.
Paco is my great companion. He's a very sweet cat that has really made my life very rich.
So do you know how it happened?
Yeah, I was moving house and there was a new cat that was in the area who was like twice his size, and I thought, ooh, that's not gonna be good if they actually meet up. But anyways, when I came back to pick him up, his eye and his ego were both very, very hurt.
Poor Paco. So Paco's one of our regular patients, and he's a loved patient, but he has got a quirky personality. He hates vets. Unfortunately, that means he hates both of us too.
When he was little, he by accident swallowed an elastic of my daughter's.
Oh, wow.
It got stuck in his intestines, and so then he also had to have intestine surgery. Ever since then, you know, even though, I mean, everybody was nice to him and everything like that, his view was as like, ooh, this is the place that cut you open.
Poor Paco.
He'll be okay.
We'll look after him. Scared. That's not a good sign.
With a potentially painful eye injury, Paco is even grumpier than usual.
So I think probably the blood's come from him rubbing or scratching, but I'm very worried about the actual eye itself. The worst thing that could happen is that there's a massive ulcer or big deep scratch under that third eyelid, which would make us a bit concerned because the eye could rupture.
I just hope there's nothing that they find actually more serious where he might have to lose the eye. But yeah, we'll just have to see.
Okay, so this is fluorescein dye. So we're basically just going to pop that inside the eye.
The dye will show up any ulcers or scratches.
So let's see how we're going to get this in the eye.
Alison will have to aim from outside the box. Paco is far too agitated to try to get any closer.
Oh! I got it.
Oh, my
How did you
goodness.
get it in
Wow.
the eye? She got it in the eye. That's pretty good for you because you really have bad aim.
I have really bad ball skills, but obviously fluorescein skills.
And we can just see there, even with that third eyelid halfway across the eye, that there's actually a pinpoint ulcer right in the middle. But what I'm concerned about is whether there's actually more injuries in the eye besides that little pinpoint ulcer. So I think we're probably going to have to bring him to hospital and give him a sedation or general anaesthetic just so we can really open up the eye, pull the third eyelid back. Obviously, if he's scratched his cornea, that's more serious. Poor Paco.
What's up?
At the Australian Reptile Park, Tim's just had an urgent SOS from friends about a rogue snake that's loose in a nearby house.
Okay, I'm coming now. Don't get bitten. First thing for me is to grab Zach. Knock, knock.
Hey, come in.
He's our head of venom, and needless to say, he's incredible with dangerous snakes.
What are you up to? Just putting this big boy away.
Zach manages 250 of the world's most venomous snakes. The Australian Reptile Park is the sole supplier of terrestrial snake venom for the production of anti-venom. We save about 300 lives every year.
I'll grab bag, hook.
Whoa.
Jim.
Woo! Who knows what we're heading out for?
What is it?
I'm not sure, but sounds like it's a decent size. We'll take my car.
Too easy, mate.
Let's go.
Tim and Zach waste no time getting to the house where the distress call came from.
Knock, knock.
Come in. Hey, Tim. Hey, Zach.
Hey, so you're there. Where is it?
Brody and Claudia are too terrified to move, with the deadly intruder now nowhere to be seen.
You know what a diamond python is. It's not a diamond python.
No, definitely not. Brown, about this long.
How long ago did you see it last?
Probably 15 minutes ago.
All right, well, you've got a table. If it comes that way, jump up, but we'll have a bit of a look.
Thank you.
This morning, I was walking to go to the office, and then I saw this huge snake. So I started screaming, obviously. So I called Brody out, and so we both started panicking a little bit.
Hoping that the boys can come in, find it, get it out, and take it away.
Nah, clear what I can see. If you're a snake and you're in a house and you begin to hear thumps on the ground, people walking, you're gonna get scared. And when they get scared, they will go to a dark spot. Under the lounge, behind the television, in the laundry, in the bathroom, under the bed, that's where we need to start looking. Just keep your eye out, you ready? It can be dangerous. I mean, you lift a cushion up on the lounge, the snake was under it and he's bitten you on the finger before you know it. So you haven't moved, so the doors that were shut were shut?
Yeah, haven't touched anything.
He's not getting under the doors. We'll keep looking. Kitchen we're at, then we'll move outside. Kitchens are always interesting, and there are always lots of hidey holes. Dishwashers, fridges, they're a prime area that snakes can find somewhere to escape and hide. Hey, look at this. Do you see that?
Yep.
We've got a bit of a slide. You see it?
Yeah, he's gonna be there. Just watch your fingers.
We've had a torch as best we can, under the fridge, around the fridge. What we're gonna do to get behind it. Ready? 1, 2, 3. Yep. Whoa, head! That's a brown. That's the world's second most venomous snake.
Oh, wow. Wow.
Here we go, Paco.
Here is Paco.
Back in Sydney, Audrey and Alison have arrived at the hospital with Paco.
We can see an ulcer in the middle of the eye, but we're actually worried there are other ulcers underneath the third eyelid. So often with ulcers, they can actually rupture the eyeball, and that's because it's a weak point that can burst. So we're going to have to give him some sedation and have a look at that eye properly.
Paco got his nasty eye injury in a fight with another cat. The grouchy 4-year-old doesn't like vets, so the girls aren't taking any chances.
Defense mechanisms we brought today, garden gloves for each of us, big fat towel. Right, gowned up, ready to go. Ready to go. So I'm gonna open. Go, 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 go. That's good, that's good, that's good, that's good.
Despite his reputation, Paco barely puts up a fight.
So at the moment we're giving Paco some oxygen and we've added in a bit of isoflurane, which is an anaesthetic gas. It's just going to make him quite sleepy so that we can eventually get him sedated to have a look at that eye. Wow, that was a bit easier than we thought. He's still growling at us. He's a bit better, he's growling less. All right, so we're going to move the carrier.
With Paco finally settled, the girls can now get their first close-up look at his injured eye.
Ooh. Oh, wow. Oh, that conjunctiva is really red. So you can just see that lower conjunctiva.
So I'm just going to give the eye a very good flush.
So there's quite a few things bulging out of the eye at the moment because it's so inflamed. This is the third eyelid.
So the third eyelid is like the windscreen wipers of the eye, and it helps actually clean the surface, get it lubricated with some tears.
Oh, look at all that pus. There's a lot of pus back too. He's actually got a hole in his third eyelid underneath, look.
Yeah. Oh my goodness, how did you do that?
He's ripped the whole underside of his third eyelid. We pull back the third eyelid and we can actually see almost like a hole at the back of it, like a big, deep scratch. So I think that's where the bleeding's coming from.
Quite an unusual injury. I don't think I've ever seen anything like that before. It's quite remarkable to think how another cat's nail
He must have just hooked it under the third eyelid and then pulled.
Torn back.
If that nail had gotten anywhere else, so if it had actually hooked into his cornea and pulled through, he could have ruptured his eyeball and potentially have lost that eye. So in a way, it's like it caught on the third eyelid and just damaged the underside of that. All right, we'll just turn off the lights. You hold that.
So we're just going to check again with some fluorescein stain and make sure there's not any more ulcers there.
The actual eye itself only has that pinpoint ulcer, which should heal well as long as he doesn't rub or scratch his eye.
Just come around this side, have a look under that third eyelid flap. I think there's something there. Okay, what is that?
All of a sudden, the girls make a shocking discovery.
Oh my goodness.
What is that?
North of Sydney,
Whoa, head! That's a brown.
Tim's just found a deadly snake hiding next to a fridge in a suburban house.
That's a solid snake. It's thick.
Terrified owners Brodie and Claudia are keeping well away.
This is a 1.5 metre eastern brown snake. It's the world's second most venomous snake. Not only are they incredibly venomous, but they're really aggressive. And when you've got a snake backed into a corner like this, in a tiny little area, that's dangerous for us. You imagine it if one of the girls walked into the kitchen and that snake is backed into a corner. It's a recipe for disaster. They are lightning fast. Grab him, mate. Good thing, hasn't it? Grab him.
While Tim makes a dash for safety, snake expert Zach corners the intruder.
There you go. What a snake. How about that? Eastern Browns are responsible for either the most or second most fatalities in Australia each year. That's a combination of where they live, their food source, rats and mice that like to live around houses, so they come here, but also strong venom and aggression if they need to. Wow.
This bad boy is feisty, so he needs to be bagged quickly.
Did you know 9 out of 10 people bitten by venomous snakes are normally bitten catching the snake or trying to kill the snake? Don't do it. 1, 2, 3. Yep. Wait for someone, or you professionals like Zach or I, to come and remove it. The worst thing you can do is take matters into your own hand. Okay, see you a bit later.
Thank you. See ya. Did a wonderful job. Found it in a very tricky spot under the fridge, caught it nice and quickly, and now it's gone, thankfully.
Now we've caught the snake, Zach's going to milk it. It gives us a chance to make sure the snake is healthy, fit, ready for release, But we can also use that venom to make anti-venom, and by catching it today, we can actually save a life. Ooh.
It's a bit fiery.
He's fiery. Just be careful, mate. You've done all the hard work, don't get nipped now. This is a critical moment. There is never a time that you are closer to its head than right now. If Zach's bitten here, it is straight to the hospital. These snakes can kill you in minutes.
Yeah, so fingers that target, not a stupid animal.
There is no simple way of milking snakes.
There we go.
It's only a really small amount in there, but that's actually a lot for an eastern brown. How many grown humans would that kill?
Without anti-venom, you'd likely knock over about 5 people my size, so...
Can you imagine that? 5 or 6 people from that tiny little minuscule amount of venom. The only way to make anti-venom is to extract real venom from real venomous snakes. Up in here looks great.
Yeah, I reckon just up here, man.
Every year, we save about 300 lives, and we're the only organisation to do so. It's a really big part of us, our heart and soul.
Right, I reckon let him go, Timmy.
Off you go.
The snake is now being released into bushland, this time well away from any houses.
See you, Charlie.
See you, bud.
Good job, mate.
Cheers, mate. Sure.
Oh, that conjunctiva is really red.
Just come around this side, have a look under that third eyelid flap. I think there's something there.
In Sydney, Audrey and Alison can't believe what they've found at the back of Paco's eye.
Okay, what is that? Right there. There's something poking out.
It's so swollen back here. Look at that. What is that?
Oh my goodness.
I'm just going to pull it out. Oh my.
This stick is massive. It turns out it's a 5 centimetre stick that's entered between the eyeball and his third eyelid.
That is insane. It's probably one of the weirdest foreign body positions I've ever seen. Poor Paco, no wonder he was so grumpy.
If we have a look behind, it's quite swollen, but the entry point's actually avoided his gland behind there, and it's actually avoided his third eye cartilage. So I think that's going to close up quite well. We'll have to monitor it, make sure it heals well, but I'm pretty confident it should seal over and look really good again.
Send Paco home with some eye drops.
So it's a bit more comfortable because we've been fiddling around there. So as long as he leaves it alone, he takes the drops in his eyes and Andrew manages to medicate him, he should heal really well. But 3 days' time, we'll come back and check on that.
It's definitely Paco's lucky day. As soon as he's fully awake, he can go home to his relieved owner.
Okay, let's get you home.
So, was she injured? She didn't get hit by a car, did she?
I don't think so.
In Bondi, Kate and Nurse Elizabeth are still trying to work out why a stray chicken was found on the loose at the beach.
I don't actually know if she's even eating that. I think she's just making a mess of it. No, you can't escape. You have to stay here. Elizabeth, have you called her anything?
Nothing, I was waiting for you.
Maybe we could call her Penny. She mustn't have been missing for very long.
Penny's in such good condition, Kate's certain she's someone's pet. So it's now time to spread the word that this little runaway is safe and well.
So it's probably not a bad idea we try and get some Facebook photos. Photo session with the chicken. Definitely has to be up there as the oddest thing that I've had to do at Bondi Vet Hospital.
Stray chicken.
Do you want to say found crossing the road down at Campbell Parade?
Okay, great.
People are going to be like, how on earth did a chicken get down to Campbell Parade? Okay, ready?
Yep.
Go.
Post.
Well, hopefully that does the trick. Hopefully we can find your owners. You just relax. Good boy. All right, Max.
On the Gold Coast, rescue cat Max has been sedated and is now fighting off the effects of a bite from a deadly paralysis tick.
Hey Max, how are you feeling?
Christy has been anxiously waiting to find out if her son's much-loved cat will pull through.
We found a paralysis tick on him.
Mm-hmm.
So that's definitely the cause of why he's wobbly on his legs. And it's quite a big one. The main thing is that you got him down here and we're going to do everything we can to help him. The thing about ticks is you don't pull them off and they instantly get better.
No, of course not.
So the sooner we can get him home, the better. Okay. Right, just in here. So he looks a lot more relaxed. Okay. His big sleepy eyes, that's just where he's had the sedation. And he's just got some oxygen going through at the moment. You want to have a see him? Yeah. We can open it for a little bit. Hey, Mum's here.
Hey, buddy. Look at your tongue.
Yeah.
You like cuddled her.
Yeah. It's okay. It's okay.
You look so drunk.
I know. Yeah, you've had your anti-venom. Now let's hope that's enough because you are so stressed here. And I think the best place for you is going to be at home. There we go. It's nice and safe in there. Good boy. You're nice and sleepy, which is good. The situation with Max now is he is so stressed in hospital that it's just, we're doing him more harm than good. So what we're going to do is he's had the anti-venom and that's his best chance of overcoming the tick paralysis. So we're actually going to get him home in an environment that he's really familiar with, where he's comfortable with his surroundings, and his mum's going to look after him there, and fingers crossed, he's going to pull through this. Main thing is you just going to need to keep him inside.
Oh yeah, of course.
And somewhere you keep a really close eye on him. So.
Yeah. All right, thank you so
All right,
much.
best of luck with him, okay?
Thank you.
All right. See you, Max.
It's all right, Bear. It's okay, Pop. It's okay. Just let her go. Oh, boss. Oh.
The next day in Melbourne, it's another traumatic morning for Danny and partner Will.
It's okay, Bear. It's okay. Good girl. It's all right.
So this morning, Will and I were woken to Bear having another seizure.
It's all right. Shh. It's okay, Bear. Shh. This is a really strong one.
It was a fairly long seizure as far as her time frame usually goes, so it was a more severe one this morning, which is a bit concerning.
It's okay, puppy.
Yeah, it's disappointing that we're still having seizures.
You're okay. You're okay, Pop. It's okay.
Pretty distressing. So yeah, it's hard to see. Poor Bear.
Long time.
Hey, Bear.
It's okay, puppy.
Hello.
Good girl. Hi.
Hello. Good girl. You're all right.
We started her on medication, but I'm really concerned that we have not got adequate control. And I think the next step is going to be getting a brain MRI. We've exhausted everything now. She's had the highest dose of both medications as frequently as she can have them, so that's not working.
Yeah.
So we need to act on this, because otherwise, if she continues to have more seizures within 24 hours, that's when it becomes dangerous.
Yeah.
Prolonged seizures in dogs, or any left untreated, can lead to brain damage or even death.
So the reason I want to get a brain MRI scan done is to see if there's anything structurally going on in the brain, like something like a brain tumour. So we need to rule that out before we continue progressing with just medical management.
Yeah, puppy.
Yes, great. We found the chicken owners.
In Bondi, Kate's been trying to find the owners of a stray chicken found wandering near the beach. And it looks like the lively chicken is ready to go home.
Hello, you guys.
Hi.
Who's this? Another chicken.
Tiger.
Tiger. So I've been calling the other chicken Penny, but it might not actually be her real name. What's her real name?
Summer.
Simba?
Summer.
Summer. Guess where she was found?
Where?
down at Bondi Beach, crossing the road.
Two very excited little girls are overjoyed that Tiger's mate Summer is okay.
And these two are friends?
They're sisters.
Sisters. All right, I'm gonna go and get Summer, you guys. Ready? They're excited, I'm excited, everyone is excited. Look who I've got, you guys. Such a beautiful moment. The girls, as soon as they saw Summer, melts my heart. I love happy endings. Makes my job so worthwhile. The challenge for this family is going to be keeping Summer from escaping again. So you guys, how are we going to make it so that Summer doesn't escape anymore?
We're getting another fence. No, we're having a leash.
A leash?
We're getting them leashes.
Leashes. Maybe some harnesses, chicken harnesses. And you can take them for walks that way.
Okay.
Okay.
Bye.
Bye. See you later.
Hey, Andrew. Hi, Paco.
It's been 2 weeks since Paco was involved in a cat fight and somehow ended up with a 5-centimetre stick embedded at the back of his eye.
Literally, once that was removed, it was amazing how much he changed.
Fingers crossed, no more fights and no more sticks.
Yeah.
Stay away from trouble, Paco.
6-year-old Bear is back to her old self.
You see Bear?
Much to the relief of Danny and husband Will.
Bear ended up having her brain MRI, which all came back clear, which was fantastic news and a huge relief. Since then, we've just been trying to titrate her medication to get the right dose to control those seizures, and I'm happy to say that they are well controlled now. So she does have them every now and again, but very infrequent, so it's a really good result, thank goodness.
At the emergency hospital on the Gold Coast, an elderly little fox terrier has been rushed in with some mysterious symptoms.
Hey Dee. Hey sweetheart. Good morning. Molly's not been herself the last couple of hours.
Okay.
So she's just been very lethargic, had a couple of vomits, just behaving not herself. Basically.
Yeah, she looks quiet. She's a bit of an older girl.
She's a bit of a senior citizen, yeah. She's gorgeous, isn't she? Hey sweetheart.
Worried owners Ian and Susan say their little girl's definitely not herself.
Last night, Moni started being a bit sick, and we sort of didn't know what was wrong with her, and she was sort of gagging and carrying on a bit and spewing.
I'm gonna have a feel of her tummy and see if she's sore. Yeah, I think she's quite tense in there actually.
She hadn't been herself all day. She'd just been a bit lethargic, and so we thought we'd better get her investigated a little bit more.
If anything, she's quite dark and in her gums, like she might be dehydrated.
Okay. What have you been up to, Moni? Not feeling the best, are you? Just got to figure out what's wrong, what's going on with her.
Suddenly, Moni's condition deteriorates.
Oh, sweetheart. You got something stuck? All right. Something's really bothering her there.
If she's got something stuck in her throat, it could be putting pressure on her airways, affecting the way that she's breathing. Anything stuck in the esophagus is also extremely painful. It can actually cause the tissue to die. It can be life-threatening.
What is going on with you?
At the Bondi Veterinary Hospital, Kate's about to make a house call to treat 2 cats
Don't forget these masks.
that may have a deadly and highly infectious disease.
Cat gloves, just in case. I've never met these cats, so I don't know how cooperative they are.
Yes.
I've just had a call from an owner that has returned recently from overseas. She's tested positive for coronavirus, and she's called because her 2 cats are showing respiratory symptoms, and apparently they're quite sick. What's been most helpful, she sent me a video.
It's very annoying, isn't it?
So we have to get quite a few swabs. It's not just like one. We need to get like
there's a
good
lot.
sort of 4 swabs. Cats have their own form of coronavirus, and that's usually what we call a gastrointestinal form. What we're talking about here, it is very rare to see cats that do get COVID-19. However, we do know that it is possible. Cat straitjacket, hopefully we don't need that. You got a thermometer?
Yes.
You've got
gowns.
Great. Good.
The cat's owner still has COVID-19, so Kate and vet nurse Kate are taking every precaution to ensure their own safety.
Before we get into that house, we need to make sure we are fully decked out in all of our protective equipment, all of our protective clothes, so that we make sure the moment that we step through those doors, that everything possible is protected. Okay, what the plan is, we're going to go get just one cat at one time, okay? And so let's just start with the easiest cat. Remember, we have to get swabbed, so let's be as efficient as we possibly can. Okay. We walk in the doors, there's these two cats, and I thought that they would both run away, but in fact, they were so beautiful.
Hey, Jess.
Hello, beautiful. Look at you two. Got your kid.
Kate must be able to keep the cats calm to take some urgent samples.
First up, we've got Jessie. Jessie's the 10-year-old male cat. He's absolutely beautiful. It's gorgeous. He's definitely got increased respiratory sound on that chest. Good boy. Just checking for any nasal discharge in Jess. You can see here he's got quite bad conjunctivitis in his eyes. Don't you, buddy?
Good boy.
Okay, so Jess has also got a really large ulceration down the back of the throat here.
Kate is becoming increasingly concerned that the other cat, Beautiful, may have the same infection.
You're not feeling very well.
On the Gold Coast, Alex is urgently trying to find out what's causing 12-year-old Moni so much distress. The little fox terrier is struggling to breathe and is becoming extremely agitated.
Okay, I'm going to get her some pain relief, Jane. Jane, will you keep an eye on her while I go talk to her family? I'm really worried about that gagging.
The gagging.
If she looks like her colour's going a bit purple, anything like that, just get her on some oxygen.
Okay.
But if that pain relief helps, then we'll just let her settle down. Okay.
Owners Ian and Susan are anxious for any news.
Hey guys.
How are you?
Now tell me about what has been worrying you with her.
Well, she was sort of gagging and being sick last night.
Okay, so she didn't want to eat this morning?
Gave her a piece of chicken at lunchtime, but she just walked away from it.
She loves her food normally,
yeah.
so she wouldn't turn chicken down usually?
No.
Usually not, no. All right, I'm going to go see if we can get to the bottom of what's going on with her, and then I'll let you know.
All righty. Okay, thanks very much.
All right, take good care of her.
Yeah, okay, thank you. Oh, she's very important. Great little dog. I'm hoping they're going to fix her.
Hey.
Oh, you're right here.
This is Moni.
Hey, Moni.
I'm really worried about her. She's been coughing and gagging.
Wow.
And she was really in a lot of distress before and she looked uncomfortable. She's better after pain relief, but I'm worried she's got something stuck.
What are your thoughts?
I'm thinking we do an x-ray.
Yeah?
Yep.
Gerardo has joined Alex to try to work out Moni's mysterious symptoms.
Oh, he's a good girl.
Good girl, Moni. Okay, ready.
Take care. Is that something there?
Something puzzling is showing up on Moni's x-ray.
Why don't we stick some dye down there?
Yeah.
So this dye, despite the fact that it looks clear, and when we take an x-ray, it actually shows up as really bright white.
Good girl.
Wow.
Whoa, that is huge.
There is definitely something there.
How did that get down there? That's got to be like a big bit of bone that's stuck there.
The dye has highlighted this monster piece of bone here.
She was obviously coughing trying to bring it up, but there's no way she would ever get that piece of bone up.
That's not going to move by itself.
Yeah, we've got to get that out quickly.
You ready, boys?
Let's do it.
At the Australian Reptile Park, Tim needs reinforcements to help him with two very special but endangered residents.
Today we're introducing our pair of cassowaries, Cassie and Cooper. In the wild in North Queensland, there's less than 1,000 breeding pairs of cassowaries, less than 2,000 birds, which makes our ability to breed them all the more important. So we'll put those eggs in, just dummies. We'll try and trigger him, let him think that Cassie's dropped a few, let Cooper in, give him 5-10 minutes, and then we'll let Cassie out.
Sounds easy.
Timing is critical when it comes to breeding these magnificent birds.
If we're off by a day and they're not ready to mate, it can end in a fight.
Tim's plan is also extremely dangerous.
They've got an incisor on the inside of their foot that is capable of disemboweling a human. We like to spend as little time as possible face to face with the cassowary. See if she takes the bait, eh?
The first tricky job will be going into the enclosure to place the dummy eggs.
The purpose of our dummy eggs is to trick Cooper, or just reiterate that Cassie is ready to mate. Before we do that, we're going to lure Cassie into this holding enclosure so that she's not in with me. 1, 2, 3, bolt. Thought it wasn't going to happen for a minute there.
Cassie was no trouble, but will her potential mate Cooper be as cooperative?
I just want to test something. That's what I want to see. Look how gentle he is. Giant cassowary, and he's just so slightly touching that egg. That's perfect, because I'm hoping that soon he comes in, sees the eggs, and begins to do that. Maybe even flip them over, and in his mind, Cassie's ready to mate, and he's about to be a dad. So I'm going to sit them there and let Cooper in on the way out, and let's see what he does, and that might give us a few more clues that today's the right day. It's time to let Cooper into Cassie's yard. He's right there. Next is the dangerous part. Any time you set foot in with a cassowary, you're on. You have to be aware that in a split second that cassowary can turn, change behaviour, and be attacking you. It can be right on you, both feet up in the air, kick after kick after kick, and that won't stop when you go to the ground. Righto, it's go time now, Obes. Hey, hey, hey!
Near Bondi,
Good boy.
Kate is trying to find out if two much-loved cats are suffering from the deadly COVID-19 virus.
So what we're going to do is we're going to take some pharyngeals, so some swabs from the back of the throat, and we're also going to take some from the inner part of the eye. We need quite a few swabs as a just in case.
Good boy. He's a good man. Oh, I know.
Jesse is not very compliant. He's got a whole bunch of ulcers, so it must be really painful for him having swabs down the back of his throat. Good boy. Good Jess. I always say that never ever fight with a cat. You will always come off second best. So we're just going to have to see how this one goes.
Boy.
Good boy.
Oh.
A bit of TLC goes a long way.
Okay, well, there's some material on there. Next up, we've got Beautiful. And Beautiful is actually a New York rescue cat. Hello, sweetheart. How are you? So I have a feeling that Beautiful might not be probably as cooperative as what Jess was. She's the female. Of course, she runs the household. So she's got less conjunctivitis than what Jessie does. And you can see that in general, she's a lot more healthy at the moment than what Jess is.
Good girl.
We're currently taking 4 pharyngeal swabs and 3 conjunctival swabs of each.
Good girl.
Even taking 1 sample is quite invasive for them. Jessie's a lot sicker than what Beautiful is. So Beautiful actually has a couple of ulcers at the back here. When we see ulcers like this, we know that there's some kind of upper respiratory tract infection. That could be viral, it could be bacterial, it could be a whole bunch of things. Do you reckon that we can have a little sample of that? There. And I just have a little... You don't have to pull it all the way down. Oh, that was good, Kate.
Okay, good job. Good girl. Okay, well done.
What was really helpful with Beautiful is how much she loves food.
Yum, yum, yum.
Snacks?
Oh, yeah?
Yeah. Okay, we're on the snacks.
She's such a girl.
I feel like as though this snack situation is working quite well.
Yeah.
from here is we're just going to make sure that we leave 2 little poo pots so that she can collect us 2 poo samples. Okay, great. We've got everything we need. We've got all the swabs, all the samples. We're going to get them off to the lab this afternoon. Now what we need to do is get rid of this gear, take all this stuff off and dispose of it completely.
On the Gold Coast,
Wow. That is huge.
Alex and Gerardo have discovered a massive piece of bone stuck in little Monty's esophagus.
We're going to anaesthetise Monty now. Once she's asleep, we can get the camera down and we can see what's exactly down in her esophagus. Right.
I'll inflate it then.
Yeah. Oh, I would inflate it just a little bit. Oh, that's really irritating her throat. All right, sweetheart.
Sweetheart, you're going to have a good sleep now.
That's it. Okay, yeah, she's asleep now. That's good.
What we're going to do is put the endoscope down Monty's esophagus and we're going to have a look and see what's down there. And hopefully we can put some grabs down and pull it out.
So I'm just lubricating the end of the scope so it goes down smoothly. Now she's only a tiny dog. She's only 4 kilos, so there's not a lot of room down there to work with. Okay, here we go. Into the esophagus.
We're in the esophagus now. Okay, keep on going.
There it is.
There it is. Oh, look at that.
Oh my God. Okay, this looks like a piece of bone, doesn't it?
Yeah, it looks like cartilage and connective tissue. Yeah.
It's taken up the whole of the esophagus, so
I wonder why it's stuck. It's huge.
that's going to be challenging. My biggest concern is if the bone that's stuck down there has sharp edges, we're not going to be able to remove it.
The claw.
Yeah.
What we're going to do is pass the claw down into her esophagus and then slowly pull it out.
Slow being the important word there. Even putting this claw down is going to cause some trauma, but we have no choice. We have to get it out.
In Melbourne, vet nurse Saraid has arrived with one of Danny's favourite and smallest patients.
Rupert is a gorgeous 12-week-old kitten that's come in today for a bit of a checkup. Unfortunately, he had a bit of a rough start to life with his first owners and has some really severe injuries that we are managing at the moment, so we'll just see how he's going today.
The strange attachment on this brave little boy is an external fixator, keeping everything in place while his injuries heal.
See how this leg's looking. So he's dislocated his elbow and he has ruptured the collateral ligament on the inside there, so it's not stable, and that's why this X-Fix is on just to help stabilise that temporarily and be reassessed to see if that elbow is going to stay in place, and if not, then we may need to amputate.
Little Rupert is also recovering from a nasty fracture to his back leg.
So he had a fracture through his tibia as well, so he's had a plate implanted to stabilise that fracture, and that looked beautiful on X-ray as well, so that's really good, and that surgical site's just healing beautifully. No swelling, signs of infection. He's not painful when I palpate along that plate either. You want to see it fusing that leg nicely, mate? Want to have a little walk around? Here you go, mate. Go have an explore. When I met Rupert about a month ago, he was in desperate need for some really expensive surgery. But luckily for Rupert, we have an incredible community of animal lovers who we've reached out to, and they really pulled through with raising some incredible funds so that he could have the surgery that he needed. They have saved Rupert's life. Well, mister, I am super impressed with you. Hey? You're just a superstar. Everything's just looking so good. He's using the legs so well. No signs of infection. I'm so happy. Hey? He's so happy. Now you just gotta go live a happy, long life now, mister. You hear me? Bye-bye.
Hopefully the fixator will be able to be removed in 3 weeks and Rupert can find a loving home.
You're the best, Rupert.
right there.
At the Australian Reptile Park, Tim is playing matchmaker, hoping his 2 endangered cassowaries are ready to mate.
I open the gate, scale the fence. I just wait for Cooper to pass and get out. Gate shut. Yep. So we've got Cooper in Cassie's yard. We'll just leave him sit, hey? Give him 10, 20 minutes to find those eggs, have a look.
4-year-old Cooper is a prime age for mating, so Tim is hoping some strategically placed decoy eggs will convince him that his female neighbour Cassie is ready for some action.
He's had a look at it, a look over it, give it a little peck. That's exactly what I wanted to see. It's now time to introduce Cassie. Shields, Obi. If it goes bad and they're really aggressive, just get in there, get between them, and if we can, we'll try and push Cooper back to his yard. Yep. But fingers crossed we get a mating. You right? Yep. Okay. 1, 2, 3. Enter Cassie. Got it, gate closed. Cassie's in with Cooper. Righto, it's go time now, Obes and Dean. This is a really calm introduction. Now, you can go from 0 to 100 like that. And we've personally been here before. Everything's rosy like this. And in a split second, you've got Cooper full throttle, just kicking Cassie. And you know, whilst this is a really big enclosure, here, she can get stuck. And that's when our job becomes critical.
Come on, bud. Let's go. That's it.
In the wild, cassowaries are solitary birds, only coming together to mate. But courtship doesn't always go to plan.
Even though Cooper is smaller, he will be the aggressor. Worst case scenario from a fight between cassowaries is death.
Come on, buddy.
In Melbourne, Danny is ready for her next patient.
Sit down. That's our boy.
And Tom's just arrived with Doug.
Doug's got a bit of a lesion on his eye. So he had it grow and then we booked him in for surgery and it fell off. So we came back and had it checked and it's going to grow again and again. So he's coming today to have that taken off. It's a boy. A good big dog.
The old golden retriever is a special part of Tom's young family.
He's so special. We had him as part of our wedding party, actually, when we got married. He had a little tuxedo on, and he's 8 years old today, actually. And he's just the sweetest dog. He's well behaved, he's very, very sweet, loves a cuddle. He's just my best bud. It's all right, it'll be quick. It'll be a quick one. It's a boy.
Hello, Doug. Hey, mate.
Who's that?
How you going? Hi. Is that lump grown back again, mate? Oh, no. So I hear it's a bit of a special day for Doug.
Yeah, it's Doug's 8th birthday. I booked him in for surgery on his 8th birthday.
Oh, Doug, I'm
Worst
sorry,
dad
mate.
ever.
I'm sorry. We'll take good care of you, though, today. You'll get lots of love and attention from us. Hey, how does that sound? Is that okay? Oh, okay. It's a deal.
That's a boy.
Doug is such a sweet soul. He's probably one of the best patients. I shouldn't say that, but he is. So the plan for today will be to take that lump off the eyelid and send it off to the lab for testing, just to make sure that it's nothing serious.
Yep, sounds perfect.
And hopefully it all goes very smoothly, mate. Hey? You good boy. All right, you want to say goodbye to Dad?
See you, buddy.
It's not exactly the best way to spend a birthday,
Yeah, Papa. All right, we'll take good care of you.
but hopefully Doug will be back with Tom in no time.
Come on, Pup. This way. Good boy.
Good
See
boy,
you later,
Danny.
Tom.
See you, Danny.
He's going to start and follow her now. This is what typically happens. She'll lead him on a bit of a walk.
So far at the Australian Reptile Park, Tim's matchmaking plan for the 2 endangered cassowaries is going well.
Cooper will follow and get closer and closer and closer. They play this game out for 10 to 20 minutes most times. That's when we either have a mating or a fight. Here he is, he's right up on her.
He's getting closer, isn't he?
Bang. The good news is Cooper has calmly sat down in the perfect position on Cassie, and they've mated. In a couple of months, could be little cassowaries. And for us now, this is when the stakes rise. They're a little frustrated now because they want to get apart.
The romance between Cassie and Cooper doesn't last long, and this is where things can quickly turn violent.
Can you see him?
Yeah, he's coming right
They're
up.
starting this.
Yep.
Hey! Get ready. Hey, hey, hey! Hey!
Tim and his team now have to try to get them apart, so neither bird is seriously injured.
Come on.
Stay there. You right, mate?
Yeah, mate. Come on.
She's pretty good. I'm going to come back down to you. We've got Cassie up in the corner, Cooper down here with Obi. They've just had an altercation, enough that one of them is going to get hurt. Obi's just making himself look bigger than he is. So rather than shielding, he's using the shield and a stick just to make his presence seem bigger.
You ready, mate?
Yes. Go on, mate.
Come on.
This is why I brought Obi out of retirement. He's the cassowary whisperer. Atta boy. Woo. Well done, mate. How's your heart?
I wouldn't like to have a heart monitor on. I think it would blow up.
Yeah, he's fired up. How's she? Is she okay? I might
Yeah,
just go
she's
in.
still up the corner.
For us, that's actually a successful mating. We've had some fighting that thankfully didn't go too far, and now we've got 2 separate cassowaries, and we repeat this again in 2 days' time. That's cassowaries for you. Another day in the office, boys.
Good day.
Good day.
Even putting this claw down is going to cause some trauma, but we have no choice.
On the Gold Coast, Alex and Gerardo are starting the delicate procedure to try and remove a large bone stuck in Fox Terrier Monty's esophagus.
I'm just going really slowly. I just don't want to push the bone further down. There's just no room.
They're using a special claw instrument to try to grab onto the bone without causing any damage to Monty's esophagus.
Okay.
Okay.
Almost got it. Yep. Okay, try closing down now. Close down. Oh yeah, you got it. Looks like you got a fairly good bite there. Good job.
Pretty good
How's
grip.
it feel?
Yeah.
Yep.
Watch that esophageal wall, that's not coming with us.
Yep.
I'm coming back really slowly.
Okay.
Here it
All right,
comes.
it's coming, it's
Yep,
coming?
Yep.
Wow. Good work.
Oh, I can smell it.
That reeks.
Wow, that is a big bone for a little tiny dog.
Good work.
I did not think we were going to be able to get that out, but oh, that's good. Good news. We're just going to go back down and see what damage is down there now.
Yeah. Or we know that bone may have been stuck there for 12 hours, 24 hours, so to make sure there's no ulcerations or no necrosis of the esophagus. Okay. So,
Oh, wow. Yeah, that's ulcerated. That would be so painful.
Yeah.
The ulceration is due to having a large object, the bone, stuck in her throat for a long time.
It's no wonder the little dog has been gagging and struggling to breathe.
So we're going to wake Monty up. She should be on medication to deal with the ulceration. The most important thing is that she can eat, so we need to keep her comfortable and protect her throat as it heals.
Monty will be monitored for a few hours and then hopefully be well enough to go home with her relieved owners.
This is a really good result. It could have been a lot worse for Monty. She must have been in so much pain, and she's really come through this procedure very well.
Whoa.
Mobile vet Audrey is making a long-distance house call today near Canberra.
Very excited to see Christy, so patients there, just checking in on them today.
Audrey's meeting up with Rosemary at the busy Possumwood Sanctuary to check up on some extra special patients.
Hi, Rosemary.
Oh, hi, Audrey. Didn't
Nice
see you
to
come.
see you. Rosemary and Steve are the owners of Possumwood. They've been rehabilitating wildlife, looking after kangaroos, and they've been doing this for over 20 years, which is amazing. Their role in the recent bushfires has been so important for these guys to recover in a safe place.
Ready for a nice busy weekend?
I am. How are my girls going?
Oh, the girls are pretty good. As soon as the fires hit, we very quickly accumulated a lot of animals with severe burns. Audrey has been a godsend to us. Come to say hello to her. Having a vet come here, it has made our job so much easier because it's very difficult. You can see she loves animals, and that's very important to Steve and I, that we have a vet here who actually loves the wildlife.
Home sweet home. Hello, Cinders. Hey, Rusty.
At Possumwood,
Hey, Pouchy. How are you going, my girl?
the animals get loads of TLC, including free run of the lounge room.
Looks like everyone's here today, so we might as well get started.
This is little Hawthorne. He's about 8-9 months old, we think, and he was found trapped in a fence by one leg. And usually when they're hanging from one leg, they can do quite a lot of damage because they're flailing around trying to get out. So he's got quite a deep wound just on his foot there that we're dressing, but also we feel like some of the nerves have been damaged. Hey, Reese. Here's Hawthorne.
Hello. How you going, Hawthorne?
A little boy fence hanger.
Audrey and animal rehab therapist Reese have been working together to treat these injured and traumatised little patients.
Reese is going to do some laser therapy on him, and we're also going to re-split that leg and just see how everything's going.
So I've got a little pair of, well, they call them doggles, they're for dogs, but in this case we're putting them on kangaroos to protect his eyes from the laser. There we are. Do you want some doggles too, Audrey?
Oh,
some
fancy.
for you. Some for
Why
you,
does he get fancier ones than me?
It will be a long road to recovery for brave little Hawthorne, but everyone is hoping one day he can go back to the wild.
All right, so we'll just take off that last layer. So we got a blob of honey actually there. So we're using the honey quite a lot if we've got deep wounds to help it granulate and heal. It's also really good at keeping infection away. Last week when we had a look at this wound, it was quite deep and we could actually see through to almost the tendon, but that's sealed over quite well just from the manuka honey, and it's actually got fresh granulation tissue in there. So we're pretty happy with how that's healing. And I guess we're just gonna have to look at how he's moving this toe, which was the concern last week.
The laser enhances the body's natural ability to heal, so what we're going to come up with is faster healing times for the injuries.
With any leg injuries with kangaroos, it's so important to fix it and fix it fast because overall they only have 2 legs and a tail to move around. And if they stop using that leg, they can put a lot of pressure on the other one.
All right, all done, mate.
Take off your cool goggles.
Oh, how's that?
Oh my God, he's so cute. Oh, there we go. Hopefully he does fully recover and we can get him back to where he came from, because the sad story is we did have to take him away from his mum when he was trapped in the fence, and he still does call out for her quite a lot. That's his mummy cry. So if he heals up, we can get him back and maybe he can find his mum again.
Okay, bit noisy, bit noisy. Oh boy, mate. Oh boy.
In Melbourne, Danny is starting surgery preparations for birthday boy Doug, who's having a lump removed from his eyelid.
Just got to give it a bit of a clean. I've just got to clean it. I promise. Just got to clean. See? Scrub, scrub, scrub. So we've seen Doug before, and he has had this recurrent issue with the lump on the eye. It tends to grow and then fall off and grow back again, and it is irritating the surface of the eye. So the plan is to remove that today. Very brave. All right, now we're just going to get some bloods from you now, okay?
A quick blood test will confirm if 8-year-old Doug is okay for anaesthetic.
So no concern on bloods today, which is great. So birthday treat for Doug, it's surgery today. All right, mate. I'm gonna go nice for a little bit.
All right, now we're going down.
At 8, Doug is considered elderly for a dog, so anaesthetic will be the biggest risk. And just moments into the procedure,
Come on, mate.
Danny is concerned.
And take some breaths, mate.
As the seconds tick by, Doug still isn't breathing properly.
Take a breath, mate. Come on, Papa.
At Possumwood Sanctuary, Audrey's next patients are mother and daughter, Indiana and Nino.
There you are, Indy and Nino. Big day for Indy and for all of us. She was actually a bushfire affected girl. Nino's her little Joey. It's the final check before we see whether she can go to the outdoor enclosure. So that'll be the first time she's allowed out without bandages. Indiana came in at the very beginning of the bushfires. She was actually in another sanctuary where they have a big enclosure for kangaroos, and a massive fire roared down the mountain and actually hit the enclosure. And she is a very protective mother. So she ran back through the enclosure just straight into the fire to try and find Nino. So you can actually see her ears are completely singed. They're all kind of crinkled at the top, and her eyelashes were all burnt off. Indy's feet were probably one of the worst. They were completely burnt on the underside, down to pretty much tendon. So you can see that the bottom of the feet have healed really, really well. We're very happy with that. And I think, you know, clean bill of health, so she gets to go outdoors today. Indiana is the biggest couch potato you'll ever find. She and her Joey permanently stay on the couch. They just love it. Oh, look at that. I'm hoping today she tries something different and has a bit of a one day outdoors for us. I think if we move Indy, because Nino's attached at the hip, he'll just follow.
With Indy and Nino looking a bit too relaxed, Audrey's going to need some help from vet nurse Brianna.
This way, this way. She just loves her couch. Stop being a couch potato. We gotta go outside to the sun at some point in your life. Come on.
These girls aren't too keen on giving up their very comfy couch.
It's definitely harder herding kangaroos, especially kangaroos that love couches.
They're not cooperating today.
Why don't you carry Nino and I will coax Indy.
Okay. All right, Nino. It's been a long journey, but here we go. Let's go.
Come on, Indy.
Look.
There we go.
Yay.
You get Nino. As you can see, it was so hard getting them off the couch because she's turned into a big couch potato. It's so nice and warm in there. It's so great just seeing her jumping and hopping. She's come such a long way, and to have her baby with her the whole time has been great.
It's hoped the next adventure for these very brave girls is back in the wild where they belong.
Hi, Mama. Good girl, Indy.
Kate has returned to Bondi after a house call to test 2 cats for the deadly coronavirus.
Hey Graham, I was just calling about the 2 coughing cats that I sent off the PCRs for the coronavirus test. The worst thing that can happen for Jessie and Beautiful is that these 2 cats test positive for COVID-19. I'm really hoping that this isn't the case and these tests come back clear. Oh, Kato.
Yeah?
I've got the results of this coronavirus test for the cats.
Okay.
Turns out it's come back negative.
Okay, that's good.
But these 2 pampered pets still face some serious health issues.
These cats are absolutely beautiful and they're obviously really well loved. The only thing that we do need to deal with is that both of them have quite a bad pneumonia and we do probably need to put them on some antibiotics. So this is a really good result, and I think these guys are going to be back to normal within a couple of weeks.
Oh, good girl.
Come on, mate.
In Melbourne, Danny's patient Doug still isn't breathing at the start of his eye surgery.
Do you want to take some breaths? Some dogs are more sensitive to the anaesthetic drug that we use, and a side effect of that is that they will hold their breath. But certainly it is a bit more nerve-wracking when they are an older patient, so come on, Doug. It's time to start breathing for yourself, mate. Hey?
After a few anxious minutes, 8-year-old Doug finally starts breathing.
Okay, Dougie boy. take you through to surgery, mate.
Danny can now begin surgery to remove a lump on his eyelid.
You know how annoying it is having something rubbing on your eye permanently, and poor Doug's had that for quite some time, so it'll be so good to remove that irritation from him.
Doug's lump removal should be straightforward,
Okie dokie. All set.
and Danny is anxious to keep him under anaesthetic for as short a time as possible.
So I want to make sure that I get appropriate margins, so we need to get the entire mass out. It is a bit tricky and delicate when you are so close to the eye, but we do have instruments to protect the eye whilst we're operating in that area. It's not a very large mass, but even something as small as that can cause serious trauma to the eye surface. And the mass actually does extend up into one of the glands of the eye too, so I think you'll be much more comfortable without this there.
The lump will be sent off for testing to make sure it's not cancerous.
So the tricky part's all done. Just a few more stitches to go, and then you'll be as handsome as ever, little Dougie. Fingers crossed Doug doesn't get any more growth like this. Golden Retrievers are quite prone to getting growth on their eyelid, so we'll have to keep a close watch on that in the future. Oh, Doug. Hey, you sleep that off now, mate. You'll be as good as new. Yes.
Four hours later, Tom's arrived to take his birthday boy home.
Oh, he's got a birthday hat.
Danny's determined to send Doug home in style.
Oh, good boy. That's a boy. It's always a very excruciatingly long wait to get the phone call to let us know he's okay.
Hi.
Oh, how are you, buddy? Oh, you look so handsome.
Hey, mate. The best time of the day is definitely handing back a beautiful, happy dog like Doug to his loving owner, Tom. There you go, party time.
There we go, Dougie.
Party time, Papa. Hey, it's your birthday party now. The surgery's gone really well today. I'm really happy with how that eyelid's come back together. So we'll see you back in a few days just to make sure everything's looking really good.
Awesome.
It was so nice to take care of Doug today. He's such a sweetheart.
Thanks for making his birthday so special.
Oh, well, we tried. I'm sure he'll be happy to get home though. All right, mate, will you go enjoy the rest of your birthday? Hey, Dougie boy, I'll see you soon. Okay, mate. Bye. Bye. See you, Doug. Happy birthday, mate.
All right, buddy. Let's go. Good boy.
Hey, what an adventure.
Little fox terrier Monty has fully recovered after getting a large bone stuck in his throat. From now on, it's definitely chicken without bones on Monty's menu.
Hey!
Those fiery cassowaries successfully mated a second time, and Tim's now hopeful there'll soon be cassowary babies at the reptile park. And great news for little Rupert. His damaged leg is healing well, and he's been adopted. Danny's vet nurse Saraid fell in love with the brave battler and has given him his forever home.
We absolutely adore him, and he's just fallen in love with our newborn son. So we've got 8 babies, 7 fur babies, 1 human. Glad we kept Rupert, otherwise we'd be uneven, so it's good.